Vertebral neural arc. It is posterior to the body. Each vertebral arc with posterior surface of the body encloses a large vertebral foramen. The series of arches along the vertebral bodies form the vertebral canal. In the adult, the upper two-thirds of the vertebral canal is occupied by the spinal cord. Each half of vertebral arc is divided into two parts, a pedicle and a lamina. The two lamina meet in the middle posteriorly to form the spinous process. Each lamina is attached to the posterolateral aspect of the body by a rounded bar of bone called pedicle. The ligament flava connect the laminae of adjacent vertebrae. The pedicle is notched superiorly and inferiorly, forming superior and inferior vertebral notch, respectively. The inferior vertebral notch is deeper than the superior vertebral notch. Spinous process. The projects posteriorly from the seat of union of right and left laminae of vertebrae. The spinous process are interconnected by ligamentum notch, supraspinous and interspinous ligaments. Transverse process. The transverse process project laterally on each side from the junction of pedicle of a lamina. Note well, the movement of the vertebral body over the other is affected in part by the action of muscles on the lever-like transverse and spinous processes. In the cervical region, the transverse process, a foramen called foramen transversium, the upper six foramen transversium, transmit all that important vertebral artery. In the thoracic region, the transverse process act as struts for ribs. Consequently, they are strong and stout. They tip bare articular facet for the ribs except for the transverse process of the 11th and the 12th vertebrae, because they do not articulate with the 11 and the 12 ribs, called floating ribs. In the lumbar region, the transverse process are thin and flat and in conformity to the grounded shape of the abdominal cavity. They are directed slightly posteriorly. Morphology of the transverse process. As mentioned earlier, the transverse process project laterally from the vertebral arc at the pediculi-laminar junction. The costal elements, pleuropophysis, develop as basic parts of vertebral arches in mammalian embryos, but become independent only in thoracic vertebrae as ribs. Elsewhere, they remain less developed and fuse with the transverse process to descriptive anatomy. Thus, except in thoracic region, a transverse process consists of two elements, a costal element and a true element. Morphologic transverse process, figure 8.4. Articular process. The neural arc has four articular processes, two superior and two inferior. The superior process project rather more from pedicles and articulate with the inferior articular process in the vertebra above. The inferior articular process springing from laminae and articular with the superior articular process of the vertebral below. The superior and the inferior articular process are above and below the junction of the pedicle and lamina, and the part of arc which separates the process is called pars intraarticularis. Direction of articular surface of the articular process. The direction of articular surface differs in several thoracic and lumbar regions. The articular surface of the superior articular process face backwards and upwards in the cervical region, backwards and laterally in the thoracic region, backwards and medially in the lumbar region. The articular surface of inferior articular process are dedicated opposite to those of superior articular process. Zygapophyseal joints. The joints between the superior and inferior articular process of adjacent vertebrae are called zygapophyseal joints. They are synovial joints. A thin articular capsule attaches to the margin of the articular facet, encloses the joint cavity. In several regions, the zygapophyseal joints slope inferiorly from anterior to posterior. This allows one to look sideways and upwards. The direct of these joints differ in cervical, thoracic, and lumbar joints. In the thoracic region, the zygapophyseal joints are oriented vertically. This limits flexion and extension but facilitates rotation. In the lumbar region, the joint surfaces of zygapophyseal joints are curved and adjacent articular processes interlock. This limits the range of movements in region, though flexion and extension still remains the major movements in the lumbar region. Note well, in all three regions, cervical, thoracic, and lumbar, the zygapophyseal joints prevent the vertebrae from slipping forward but allow the flexion and extension of the vertebral column. Intervertebral foramina. The two adjacent vertebral notches together form a intervertebral foramen, which can be seen when two adjacent vertebrae are viewed from the side. And circling the vertebral foramen are two pedicles, one an intervertebral disc, two articular processes forming facet joints, and a capsule in uniting them. Throughout the length of the vertebral column, intervertebral foramen provides passage to the spinal nerves. Each spine nerve is attached to the spinal cord by a posterior and anterior root. The close relationship of a spinal cord and intervertebral disc is very important, for it is compressed in disc prolapse, producing neurological signs and symptoms. A space between vertebral arches. The laminae and spinous process of adjacent vertebrae overlap in most parts of the spine. However, in lumbar region, where they leave big gap between them, these spaces are widened further by flexion of the spine to allow easy access to vertebral canal to perform clinical procedures. For example, punch, lumbar puncture. Note well, nucleus pulposus of intravertebral disc usually herniates posteriorly and compressing a nerve root. Clinical correlation. Radiographs of vertebral column. They are usually taken in intraposterior and lateral views. In interposterior views, the spinous process appears to avoid or somewhat elongate shafts and pedicles appears as ovate shadows. In lateral view, the bodies and intervertebral discs are cleanly seen. Special features of vertebrae in different regions. Cervical vertebrae and note well. The first cervical vertebrae is called Atlas and supports the head. It is named after Atlas, a famous Greek titan who, according to Greek myth, was reputed to support the heavens on his shoulders.
The vertebral column, they are usually taken to anterior-posterior and lateral views. In anterior-posterior views, these spinous processes appear as ovate or somewhat the elongated shadows, and pedicles appear as white shadows. In lateral view, the bodies and intervertebral discs are clearly seen. A special feature of vertebra in different regions. Cervical vertebra. The transverse process of cervical vertebra process a foramen called the foramen transversarum for the passage of vertebral artery, except for CV7 to supply the brain. For the foramen transversarum is the cardinal feature of the cervical vertebra. The first cervical vertebra consists simply of a ring of bone with two short transverse processes. Remember, first cervical vertebra has neither body nor a spine. The anterior part of the last vertebral foramen is occupied by the dens, also called the odontoid process, a tooth-like projection from the body of axis. The odontoid process of axis is held in position by the transverse ligament of the atlas. The posterior part of the vertebra foramen is occupied by the spinal cord. Two superoarticular facets on the superior aspect of the atlas from the joint with the condyles of the occipital bones called the atlanto-occipital joints. The noting movement, yes, movement of the head take place on at this joint. And B. The first cervical vertebra is called the atlas and support the head. It is named after Atlas, a famous Greek titan who, according to a Greek myth, was reported to support the heavens on his shoulders. The second vertebra has a small body with an upward projection tooth-like process. The dens of the odontoid process they articulates with the first vertebral cervical vertebra, the atlas to form the median atlanto-occipital joints. Presence of odontoid process is the cardial feature of the second cervical vertebra. This joint allows the side-to-side movement, no movement of the head. The second cervical vertebra is called the axis because it forms the pivot around which atlas carrying head rotates like a wheel. The term axis is derived from the Sanskrit word asakha meaning pivot. Axa, A-K-S-H-A. Aksha means pivot. এই দেখো cervical vertebra, foramen, transverse foramen, articular facet on the transverse process, articular facet on the side of body. A special feature of the vertebra in cervical, thoracic and lumbar vertebral region. The intervertebral is cervical, thoracic and lumbar. Thoracic vertebra. The bodies and the transverse of thoracic vertebra process the articular facet for the articulation with the ribs. The articular facet on the sides of the body from the cardinal feature of the thoracic vertebra. Lumbar vertebra. Lumbar vertebra have largely kidney-shaped bodies. These spinous processes are broad and hesset-shaped. The special feature of the lumbar vertebra is the presence of mammillary and accessory process. They are, however, visualized only on careful examination. The cardinal feature of the cervical, thoracic, lumbar vertebra are given in this cardinal feature of cervical, thoracic, lumbar vertebra. The cardinal feature cervical is the presence of foramina transversarum. Thoracic, presence of costal facet on the body. Lumbar, presence of mammillary and accessory process. তিনটা জিনিস cervical foramina transversarium, thoracic presence of costal facet on the body আর lumbar হচ্ছে presence of mammillary and the accessory process. Sacrum, it is the triangular wedge-shaped bone formed by the fusion of the 5 rudimentary sacral vertebra. Upper aspect of the body of the first sacral vertebra articulates with the body of the fifth lumbar vertebra on each side. The upper part of the sacrum articulates with the ilium to form the strong sarcoileal joint. The inferior tip of the sacrum articulates with the base of coccyx. The cavity within the sacrum canal, contains the root of the sacral and coccygeal nerves. Coccyx. It is a small triangular bone formed by the fusion of the 4 terminal rudimentary vertebra. The broad base of the coccyx articulates with the tip of sacrum. The coccyx represents the tail in the human beings. Intervertebral discs. Bodies of the adjacent vertebra are united by the intervertebral discs. The disc consists of 2 parts. An outer rim of the fibrocartilage is called the annulus fibrous. Central core of the soft gelatinous jelly-like material called the nucleus pulposus. Remember the embryonic notochord, which acts as the cushion or shock absorber. All the nucleus pulposi is central in cervical and thoracic regions. In the lumbar region, it lies slightly more posteriorly. In children, the nucleus pulposa has high water content, a small collagenous element, a few cartilaginous cells. In newborn infants, the water content is almost 90%, but the advancing age in decrease so that in elderly individuals it is under 70%. When the vertebral column is exposed to an increased load. It acts as a hydraulic shock absorber. The semilunar character of the nucleus pulposus permits it to adapt itself readily to the change in its form as one vertebra knocks over another during the movements of the vertebral column. The annulus fibrosus consists of many concentric layers of the collagenous fibers. This arrangement of fiber limits the rotation between the vertebra. The annulus is slightly thinner posteriorly. কি রে ভেঙে যাবে তো ভাবছে this arrangement of the fibers limits the rotation between the vertebra. The annulus is slightly thinner posteriorly than what it is anteriorly and can rupture particularly in the lumbar region. তারপর হচ্ছে ভার্টিব্রাল বডি থিন প্লেট অফ দ্য হাইল্যান্ড কার্টিলেজ নিউক্লিয়াস প্রসেস ইন্টারভার্টিব্রাল ডিস্ক অ্যানুলাস ফাইব্রাস ছবিগুলো দেখো তারপর হচ্ছে nucleus pulposus, annulus fibrosus, posterior ligament filament, vertebral body, anterior longitudinal ligament, a structure of intervertebral disc, anterior view, superior view of the transverse section. In the lumbar region, discs become somewhat thicker anteriorly, especially between lumbar 4 and lumbar 5, between lumbar 5 and sacral 1. The degenerative changes in annulus fibrosus can lead to herniation of nucleus pulposus, inappropriately called the discs. Along with the plate of hyaline cartilage covering the vertebral bodies, the intervertebral disc forms a secondary cartilaginous joint, symphysis. The intervertebral discs are kept in position by the anterior and posterior longitudinal ligaments of the vertebral column. The anterior longitudinal ligaments extend the whole length of the column and lies in front of the vertebral bodies. Posterior longitudinal ligament also extends the whole length of the vertebral column and lies inside the vertebral canal in close contact with the vertebral bodies. The anterior longitudinal ligaments in a broad, strong band, whereas the posterior longitudinal ligament is weak and narrow. Clinical correlation: discs. The protrusion of the nucleus pulposus through a tear in the annulus fibrosus is termed as slip disc. The prolapse generally occurs posterolaterally, but sometimes it occurs posteriorly. Posterior prolapse directly presents the spinal cord, whereas the posterolateral protrusion presses on the roots of the spinal nerves and their sensitive covering, leading to pain in the area of the distribution of the nerve root pain. Disc prolapse is generally seen in the cervical and lumbar region. Cervical disc prolapse. The prolapse of the disc in cervical region is less common than the lumbar region. Discs between the cervical 5 and 6 or 6 and 7 is most susceptible. Lumbar disc prolapse. The prolapse of the disc is common in lumbar region. Discs between the lumbar 4-5 and lumbar 5 and sacral 1 are more susceptible. The commonest presenting symptom is low backache, lumbago. The important feature of the prolapse discs at various vertebral level are presented in table 8.2. The disc between lumbar 5 and sacral is most commonly herniated. It compresses the sacral 1 nerve root. Herniated discs can be well located by the MRI. Sometimes the plate of the hyaline cartilage covering the body of the vertebra cracks following the fracture of the vertebral body. This leads to herniation of the nucleus pulposus into the spongy part of the body, forming a nodules that may detect the radiograph. MRI the lumbar region showing the herniation of the discs between the lumbar 4-5.
Table 8.2 Neurological deficits due to prolapsed disc at various vertebral levels. Herniated disc between C4 and C5, between C5 and C6, between L4 and L5, between L5 and SI. Compressed nerve root C5, C6, L5, S1. Area of sensory loss and pain: shoulder and lateral aspect of arm, lateral aspect of foramen and hand, lateral aspect of thigh, leg, dorsum or foot. Posterolateral aspect of cleft lateral border of foot. Muscle affected. Deltoid biceps. Extensor carpi radialis longus branchioradialis. Tibialis anterior extensor hallucis longus extensor digitorum longus. Gastrocnemius soleus. Movement affected. Abdominal of arm. Flexion of forearm. Extensor of wrist. Dorsiflexion of ankle. Cannot stand on heel. Plantar flexion of ankle. Cannot stand on toe. Reflex. Biceps jerk. Supinator jerk. None. Ankle jerk. Vertebral cracks following the fracture of vertebral body. This leads to a herniation of nucleus pulpus into a spongy part of the body, forming a nodule. Squamous model that may be detected in radiograph. Curvature of the vertebral column. When viewed from the side, the adult vertebral column presents four curvatures: cervical, thoracic, lumbar, and sacral. Figure 8.12. Curvature of the vertebral column. The thoracic and cervical curvature are termed as primary curvatures because they are in the same direction as the curvature of the fatal vertebral column. The cervical and lumbar curvature are termed as secondary curvatures as they developed after birth. The secondary curvatures are concave posteriorly and therefore compensate for and counteract the primary curvature. Development of curvature. Fetus after birth. Adult. In prenatal before birth, the vertebral column is uniformly curved with concavital facing ventrally, with the result that the head and neck are more or less touching each other with the head and neck are more or less touching each other. This position shows primary curvature, fetal curvature. The secondary curvature appears after birth as follows: cervical curvature with convexity facing afterwards. Lumbar curvature with convexity facing afterwards develops when the child acquires the art of standing and walks erect at about the age of 18 months. In the thoracic and sacral regions, the ventricular concavities persist as in parental life, hence called primary curvatures. Abnormalities of the vertebral curvature. There are as follows: kyphosis. This is an exaggeration of posterior convexity of thoracic curvature. It can occur in old age due to osteoporosis or degeneration. Lordosis. Sway back. This is an exaggeration of interior convexity of the lumbar curve. It can occur as a result of pregnancy or a pot belly. Scoliosis. Crookedness. This is an abnormal lateral curvature of the vertebral column, either to the right or the left. It is commonest in the thoracic region. It can be caused by polymyelitis, a short leg, or hip disease. Development of curvatures of the vertebral column. Clinical correlation: decrease in height of an individual. The height of an individual, particularly the one which carries heavy load on his head, may be shortened in the evening than the morning because with fatigue. may be shortened in the evening than in the morning because with fatigue, curvatures of the spine are increased. Turgor of the nucleus pulposus of the vertebral disc is decreased. Height of the arches of the feet is decreased. After recuperative rest at night, the person regains normal height in the morning. The height of an individual in old age becomes less due to flattening of the intervertebral disc following dissection and high dehydration of the nucleus pulpus. Line of gravity. The line of gravity passes through the body of axis vertebra anterior to the scrotum, posterior to the center of the hip joints, anterior to the center of the knee joints, and anterior to the center of ankle joints. Since the greater part of the body weight lies anterior to the vertebral column, deep, the deep muscles of the back are important in maintaining the normal curvatures of vertebral column in the standing position. Clinical correlation. Clinical correlation: backache and leg ache in females. In females who wear high heel shoes, the posture becomes unnatural. There is there is forward tilt of their bodies. Their knees are excessively bent and their spine is thrust forward at the lumbar curvature to maintain balance. Consequently, there is a shift in the line of center of gravity of the body, putting an undue strain on muscles and ligaments of the back and leg to maintain erect posture. This leads to backache and leg ache. Thus, females who wear high heel shoes have perpetual backache and leg ache. Line of gravity. Vertebral column and its muscles. The posture and flexibility of the vertebral column are controlled by groups of muscles that are disposed vertically parallel to the column and obliquely surrounding the trunk of on the back. These groups of muscles form a discontinuous layer of sheath that extends from the base of the skull to the scrotum. For example, this muscle sheath is broken up into short segments. Although broken up into short segments, the functional unity of whole is secured by having the insertions of one short group overlapping by the origins of another in a relay race fashion. Vertebral column and its muscle. The muscle groups have a specific action when they act against the resistance such as gravity due to influence of gravity upon the muscle action. When the trunk is bent forward, the extensor muscle of the back gets tense and control bending. Similarly, when the column bends slightly to one side, the contralateral muscle becomes tense to control this movement. Similarly, when the column bends slightly to one side, the contralateral muscle becomes tense to control this movement. Thus, there is an ever-shifting balance of power between muscles groups to study the column and oppose the influence of gravity.
Incidence of backache. Students should have some working knowledge of muscle of the back. The muscles of the back are divided into two columns called the erector spine. True muscle of the back. Each column consists of superficial long muscle and deeper short muscle. Long muscle passes across many vertebrae. Deeper shorter muscle join adjacent vertebrae. The longer muscle maintains the normal posture, maintain normal spinal curvature, while the smaller, deeper muscle constantly adjacent the position of one vertebra to another. The erector spine has a pneumatic attachment to the back of sacrum adjacent iliac crest and lumbar spinous process. As it ascends, it splits into three columns: lateral, intermediate, medial, known as the iliocostal, longissimus, and spinalis, respectively. Each of these columns is divided into three relays according to their levels as follows: iliocostalis lumborum, iliocostalis thoracis, iliocostalis cervicalis. Longissimus thoracis, longissimus cervical, longus capitis. Spinalis thoracis, cervix and capitis. Clinical correlation: posture at work. Normal posture is very important while working, particularly for longer periods. Some people instantly adapt the posture, which relieve the tired muscle, but remember it throw up undue strain on the ligaments of the intervertebral joints, leading to continuous backache. While working, one should try to keep his and her vertebral column erect. Extension: the flexion of the vertebral column increases the presence of the anterior portion of the intervertebral disc, thus pushing the nucleus pulposus posteriorly, where the annulus fibrosus is thinner. This is especially so in the lumbar portion of the vertebral column. Any weakness posteriorly allows the nucleus pulposus to herniate posterolaterally, causing disc collapse. Semi-spinous capitis, erect spine muscle. Erector spinous muscle, true muscle of the back. Semi-spinous capitis, spinous capitis, longissimus capitis, longissimus cervicis, spinous cervicis, iliocostalis cervicis, iliocostalis thoracis, spinous thoracis, longissimus thoracis, iliocostalis lumborum, erectile spine, erect iliac crest, aponeursis of the erector spine. Movements of the vertebral column. The amount of movement between any two adjacent vertebrae is very small, but when these movements are put together, the movements of the column as a whole becomes quite extensive. Movements of the vertebral column include the following: flexion, bending forward, extension, bending backward, forward, backward, lateral flexion, bending to the side, and rotation, twisting on either side. The movement between the two vertebrae is most free where the disc is thickest, vertebral height, namely in the cervical and lumbar region. Conversely, the movement is least where the disc is thinner, such as the mid-thoracic region. Movement of the vertebral column: flexion, extension, lateral flexion, rotation are self-expanding, explanatory, but the degree of the movement of cervical, thoracic, and lumbar region requires further consideration. While considering the degree of movement of three principal features that should be taken into account are the zygaprophyseal joint, rib cage, and the elasticity of the vertebral disc. In the cervical region, all movements are possible, and there are hence by the movements occurring between the atlas and the axis. Between the atlas and the base of the skull, the head of the neck have a considerable range of movements which they control to a fine degree. This is the keeping with the need of accurately position of the organs of sight and hearing of the smell. Clinical correlation: hip whiplash injury. The movements of the flexion and extension of cervical spine diminish from the superior to the inferior half of the cervical region. Accordingly, the inferior half of the link to the handle of a whip and superior half of the lash. Therefore, the sudden change of momentum procedure, so called the whiplash injury, roughly at the mid cervical region. The whiplash injury occurs classically as a result of near impact when a slightly moving vehicle strikes another vehicle in front. The whiplash injuries are now a common cause of the persistent cervical pain. In thoracic region, the movements of the vertebral column are and
Whiplash injury, the movement of flexion and extension of cervical spines diminish from the superior to the inferior half of the cervical region. Accordingly, the inferior half is link is linked to the handle of the whip and superior half to the lash. Therefore, sudden changes of momentum produce the so-called whiplash injury. Roughly at the mid-cervical region, the whiplash injury occurs classically as a result rear. In the thoracic region, the movement of vertebral column are in thoracic region, the movements of vertebral column are handicapped by rib cage. However, the zygapophyseal joints are designed to allow maximal rotation as it to compensate for the limitation imposed by rib cage. The maximum rotation occurs in the mid thoracic region. In the lumbar region, little rotation occurs due to nature of configuration of zygapophyseal joints in the region. The flexation, extension, and lateral flexion are principal movements of lumbar spine. Clinical correlation: forward bending of lumbar spine includes the movement at the hip joints. An orthopedic surgeon, physiotherapist, while analyzing the flexion of lumbar spine, must take into account the flexion at hip joints. Movements of vertebral column: flexion, extension, lateral flexion, rotation. Golden facts to remember. Multiple choices. Golden facts to remember.
Total number of vertebra in the vertebral column 33. Total number of the two vertebrae in the vertebral column 24. Largest vertebra, fifth lumbar vertebra, number 5. All the two vertebra have body except first cervical vertebra. Thickest intervertebral discs between lumbar 5 and sacral 1 vertebra. Commonest site of the disc prolapse, intervertebral discs between lumbar 5 and sacral 1. Most susceptible discs for herniation in the cervical region, discs between cervical 5 and 6. Most important investigation to confirm the disc prolapse, MRI. Magnetic resonance imaging. Commonest site of the spondylosis, cervical region. Commonest site of the Wilpus injury, mid cervical region. Most commonly fractured thoracic vertebra, 12th thoracic vertebra. Commonest site of sacroiliasis, thoracic region. Commonest site of the spondylolithosis between lumbar 5 to sacral 1 vertebra, slipping of the one vertebra over the other. Commonest congenital anomaly of the vertebral column হচ্ছে spina bifida. Commonest site of the fracture of the dislocation in the vertebral column, dorso-lumbar region, thoracic 12 to lumbar 1 vertebra. Most common site of the compression fracture of the vertebral lumbar region. Most common tumors of the vertebral column, sarcoidosis, metastasis tumors. Commonest site of the tuberculosis of the vertebral column, cervical region. Sachumari's node, the extrusion herniation of the nucleus purposus into the body of the vertebra. Multiple choice of the questions. Select the incorrect statement about the cervical column is 1C. It possesses the true curvature. All the following segments are true about the vertebral column except vertebral bodies act as a shock absorber during the running and jumping. Select the incorrect statement about the zygapophyseal joint. এটা হচ্ছে they are joined between the laminae of the two adjacent vertebra. Select the incorrect statement about the direction of the articular surface of the superior articular process. এটা হচ্ছে directed backwards and downwards in thoracic region. All of the following statements are about the intervertebral discs except that they are thickest in the thoracic region. The function of the intervertebral discs, including all except that they enhance the rotation between the vertebra. Select the incorrect statement regarding the movements of the vertebral column. Movements are facilitated by the rib cage in the thoracic region. Select the incorrect statement about the disc prolapse. It mostly occur anterolaterally.
Chapter 9: Muscular System. Learning Objectives. After studying this chapter, the student should be able to define muscles and describe their four basic properties. Difference skeletal, cardiac, and smooth muscle. Describe the gross features and typical skeletal muscle and discuss the lubricating device that facilitates movement of muscle tendons. Compare and contrast the red and white fibers in the skeletal muscle. Describe the various types of muscle fibers, architecture, and biomechanical advantage of each type. Discuss the microscopic features of a skeletal muscle. Define motor unit and explain why motor units are considered a basic functional unit of muscle contraction. Use examples to describe the various ways in which the muscles are named. Discuss group action of muscle and explain what is meant by synergistic and antagonistic muscle groups. Correctly solve the review question given at the end of the chapter. Introduction. The muscle is a contractile tissue of the body derived from the mesodermal layer of embryonic germ cell. It forms the red flesh of the body and contains about 40% of the body weight. The muscle tissue is composed of different cells containing contractile proteins. The structural biology of these proteins generates the forces necessary for cellular contraction. Thus, muscles are responsible for bringing about movements within the certain organs and the body as a whole. Hence, they are regarded as the motor of the body. Figure 9.1 Muscle, the motor of the body moving its various parts. Thus, muscle can be defined as follows. It is contractile tissue which brings about the movement of organ and body as whole. Note well, all the muscles of the body develop the mesenchyme except aristotelium, muscles of iris, and metaphyseal cells of gland which develop the ectodermal. Types of muscles. On the basis of morphology and functional characteristics, the muscles are classified into three types. Skeletal muscles, voluntary, smooth.
Attached to the skeleton, the smooth muscle from the walls of viscera and the cardiac muscle from the wall of the heart, myocardium. These three types of muscle differ considerably from each other. The difference between these three are enumerated in table 9.1. Apart from the skeletal muscle, skeleton, cardiac, smooth muscle, there are the contractile cells which function as single as units, myofibril cells, myofibrils cells as spindle-shaped epithelial cell containing contractile protein in the form of action filaments. They are present at the bases of secretory acme of the glands. Example is salivary, lacrimal, mammillary, and sweat glands. Between basement membrane and the peripheral surface of the epithelial cells of acne, the contraction of the myoepithelial cell helps in the expulsion of secretion from the acne. Myofibrils as involved in the wound healing. Basic properties of muscles. Although the structure and function of the skeletal, cardiac, and the smooth muscle are different from each other, they share the following basic property: irritability, sensitivity to stimuli, contractility. When stimulated, the muscle contracts lengthwise, leading to the shortening. Extensibility. Once the stimulus is removed, the muscle fiber return to their original length. Elasticity. Muscle assumes a desired shape regardless of how it might be stretched. The structure and the function of the smooth muscle are better understood when they studying the involuntary organs of the body and those of the cardiac muscle when studying the heart. The following knowledge is restricted only to the skeletal muscle as they are clinically more relevant. Skeletal muscle. Skeletal muscle are most abundant. They are located superficially and mostly found attached to the skeleton. They are displayed by the student during dissection of cadavers. এখানে হচ্ছে flattened muscle of periphery of the muscle fiber আর prominent transverse section, এটা skeletal muscle. cardiac muscle perinuclear space, nuclear central in intercalcated disc and faint transverse striations. আর হচ্ছে smooth muscle spindle shaped smooth muscle fiber, elongated oval muscle in the central widest part muscle fiber. Skeletal muscle perform the function of levers to move the body and its appendage to perform day-to-day activities. As an overview of layout of major social skeletal muscle in the body in shown in figure 9.3. Clinical correlation: the skeletal muscle are commonly paralyzed and hence tested routinely by the clinician in clinical practice. Often injury, particularly in athletics, commonly used to intermuscular junction. Vice versa, deltoid muscle in shoulder region, gluteal medialis muscle in gluteal region, and vastus lateralis muscle in the thigh region. The site of intermuscular infection are given in table 9.2 and figure 9.4. For above reason, they are described in detail in the following test. Difference between the three type of muscles: skeleton, smooth, and cardiac. প্রথমে হচ্ছে cardiac and synapse. Synapse হচ্ছে smooth muscle are voluntary straight. Myocardium involuntary and non-straight or smooth হচ্ছে smooth muscle. Location: easily attached to the skeletal muscle. Cardiac muscle present in wall of the heart. আর হচ্ছে smooth muscle present in the wall of the hollow viscera. Example, the gastrointestinal tract, respiratory tract, urogenital tract. তারপরে হচ্ছে তোমার কন্ট্রোল ভলান্টারি, কার্ডিয়াক আর স্মুথ মাসেল ইনভলান্টারি. মাসেল ফাইবার্স আনব্রাঞ্চড সিলিন্ড্রিক্যাল মাল্টিনিউক্লিয়েটেড নিউক্লাই লোকেটেড পেরিফেরি, এটা স্কেলেটাল মাসেল. আর হচ্ছে তোমার ক্রস স্ট্রেশন প্রেজেন্ট, তাও স্কেলেটাল মাসেলে. আর কার্ডিয়াক মাসেলে ব্রাঞ্চ সিলিন্ড্রিক্যাল উইথ characteristic intercalculate discs, junction between the muscle fibers, single nucleus, nuclei located centrally, cross striation faint. আর এটা হচ্ছে cross striation present. তারপরে স্মুথ মাসেলে আনব্রাঞ্চ স্পিন্ডেল শেপড, সিঙ্গেল নিউক্লিয়াস, নিউক্লাই লোকেটেড অর centrally, no cross striations. Rhythmicity, skeletal muscle absent আর cardiac আর smooth muscle present. Function: movement of the body parts, pumping of the blood from heart, movement of the viscera. Nerve supply somatic and cardiac or smooth muscle autonomic. Stress receptors present and cardiac or smooth muscle absent. Neuromuscular skeletal muscle present or cardiac or smooth muscle absent. Neuromuscular junction. Function of the skeletal muscle. Skeletal muscle perform the following general function: motion, heart production, heat production, posture and body support. Motion and heat production, posture and body support. Motion: it is the most obvious function. When the skeletal muscle contract, the muscle move the body and or its appendages, walking, running it. Heat production: metabolism with the muscle cell realize heat as the end product. Their rate of heat production increase immensely when a person performs a strenuous exercise. Posture and the body support: the skeletal muscles maintain posture by providing support around the flexible joint. Postural function are at work even when the things that away are released. When one is sitting, the head is balanced at the atlanto-occipital joint by muscles at the back of the neck. When one gets sleepy, the head suddenly nods forward as postural muscle relax and weight overcomes the force. Microscopic structure: skeletal muscle is made up of muscle fibers and supporting connective tissue. Each fiber is surrounded by the delicate connective tissue called the endomysium. Each bundle of muscle fibers or physically is surrounded by a closer connective tissue called the perimesteum. The dense connective tissue surrounding the entire muscle is called the epimysium. At the junction of the muscle belly with the tendon, the fibers of the endomysium, perimysium, and epimysium become continuous with the fibers of the tendon. Muscle fibers. Skeletal muscle fibers are longer than those of smooth muscle. The length ranges from the 1 to 40 millimeter diameter and 10 to 100 millimeter. Each muscle fiber myocyte is multinucleate, coarse, straight, and cylindrical. The nuclei are oval and located at the property of the fiber under plasma membrane and sarcolemma. The cytoplasm of muscle fiber is called the sarcoplasm. The sarcoplasm contains longitudinally oriented bundles of the myoproteins, which are made up of the contractile periproteinaceous filaments called the myofilaments. The myofilaments are of two types, thin and thick. The regular arrangement of the myofilaments within the muscle fiber gives a characteristic concentrated.
Supporting tissue. Each fiber is surrounded by a delicate connective tissue called endomysium. Each bundle of muscle fibers, i.e., fasciculus, is surrounded by a closer connective tissue called perimysium. The dense connective tissue surrounding the entire muscle is called epimysium. Note well, at the junction of a muscle belly with a tendon, the fibers of endomysium, perimysium, epimysium become continuous with the fiber of the tendon, muscle fibers. The skeletal muscle fibers are longer than those of smooth muscle. Then the length ranges from 1 to 40 millimeter in and diameter from 10 to 100 meter. Each muscle fiber myocyte is multinucleated, cross-striated, and cylindrical. The nuclei are oval and located at the periphery of the fiber. Under the plasma membrane of sarcolemma, the cytoplasm of muscle fiber is called sarcoplasm. The sarcoplasm contains longitudinally oriented bundles of myofibrils, which are made out of contractile proteinaceous filaments called myofilaments. The myofilaments are of two types, thick and thin. The regular arrangements of myofilaments within the muscle fiber gives a characteristic of cross-striated appearance. Temporalis sternocleidomastoid, pectoralis major, biceps brachii, rectus abdominis, sartorius, rectus femoris, vastus lateralis, vastus medialis, gastrocnemius, tibialis anterior, retinaculum, occipitalis, trapezius, deltoid, trapez brachii, latissimus dorsi, gluteus medius, gluteus maximus, hamstring muscle, gastrocnemius, tendocalaneus, major superficial muscle of the body, anterior view, posterior view. Table 9.2 Common site of the intramuscular infections. Muscle and site, deltoid, upper and outer quadrant of shoulder region. Gluteus medius, upper and outer quadrant of gluteal region. Vastus lateralis, anterior aspect of mid thigh. Figure 9.4 Common site of intramuscular infections. A. Shoulder region. B. Gluteal region. C. Thigh. Cross-strained appearance is due to the cytoplasm of the fibrous, which shows the alternating dark and light bands, which polarized light and bands that appears darker with light microscope are anisotropic, while those near the light with microscopes are isotropic. They are called A bands and lighter bands I bands. The darker bands are called A bands and the lighter bands are called I bands. The middle of a band is dissected by a lesser dense line called H line. And then I bands are disgusted by the dark line called Z line. In the region of dark A band, the thin and thick myofilaments partially overlap each other. Then I bands containing only thin myofilaments. The H band present in the center of the A band contains only thick myofilaments. The M line is darker line seen in the center of the H band where the thick filaments are held together. Figure 9.5 Structure of muscle at growth, microscopic and submicroscopic levels. The region of thick and thin microfilaments between the two Z line called sarcomere. It is the contractile unit of the myofibril proteins. They are of two types. The thick myofilaments consist of protein called myosin. The myosin constitutes of 60% of myofibril protein, and it is the most abundant contractile protein. The thin myofilaments consist of protein called actin and tropomyosin. Mechanism of contraction. Sarcomere is the basic unit of the contraction. It consists of two types of myofilaments arranged parallel to long axis of myofibril. Thick filaments are composed of protein myosin and occupy the A band. Thin filaments are composed mainly of protein actin and also tropomyosin and troponin. On end of each of these filaments run between the parallel of thick filaments in the A band or for some distance. In order end of thin filaments is attached to the Z line is the I band. During muscular contraction, the thin action filaments slide between the thick myosin filaments towards the center of sarcomere, thus bringing the attached Z line closer, leading to shortening of the contractile unit, i.e., sarcomere. Figure 9.6 The sliding filament model of contraction. When the myofilaments slide, the Z lines are brought closer together. The length of a band remains some during contraction. The I and the H bands narrow progressively and are eventually obliterated. Note 12. During the contraction, there is no shortening of individual thick and thin filaments. The sliding of filaments occur under the influence of energy released from ATP and calcium ions released from the sarcoplasmic reticulum. Clinical correlation. Rigor mortis. It is stiffening of voluntary and involuntary muscles of the body after death. It starts 2 and 4 hours after death and completes after 6 to 12 hours. It gradually disappears within 2 to 4 days. It helps in medical cases to determine medical cases to determine the time of death. The rigor mortis occurs due to depletion of adenosine triphosphate ATP in the muscle. The mechanism is as under. ATP level stores transport calcium ions into the sarcoplasmic reticulum. Leakage of calcium ions from sarcoplasmic reticulum to sarcoplasm due to breakdown of reticulum after cell death. Calcium level in sarcoplasm. Formation of cross bridge between the actin and myosin. Myosin fails to separate from action due to lack of ATP, and consequently muscle fails to relax and remains stiff unless the tissue degeneration occurs. Types of skeletal muscle. The skeletal muscle fibers are classified mainly into two types: red type, type 1, and white type, type 2. Red fibers are slow twitch fibers, i.e., the speed of contraction is slow but more sustained. They are fatigue resistant and hence largely present in postural muscle, long muscles of the back, anti-gravity muscles. White fibers. White fibers are fast twitch fibers. For example, their speed of contraction is fast but less sustained. They are easily fatigued and hence largely present in extracellular muscles of the eyeball. The above mentioned fibers have different characteristics features based on their functions. Clinical correlation. The slow twitch muscle fibers function very well for long distance running. In addition, exercise that causes the muscle to perform aerobic metabolism improves their ability. Aerobic exercise combined with slow twitch fibers are the best combination of long distance running. Fascicular architecture.
The arrangement of the muscle fiber in individual muscle varies a great deal and is often dependent upon the function of the muscle concerned. The major type of arrangement of the muscle fibers of our fasciculi are described in the following text. The parallel fasciculi, the muscle fibers of fasciculi are parallel to the line of the muscle. Such muscle contract. Characteristic feature of the red and white skeletal muscle fiber. Characteristic feature red fibers, white fibers. Speed of the contraction slow and fast. Fatigability, fatigue resistant and fatigue susceptible. Blood supply rich, white fiber and blood supply poor. Myoglobulin content high and low. Generation of ATP by anaerobic glycolysis. Number of the mitochondria many and white fiber few. Glycogen content high, smaller and larger. দোকানটা ইয়ে কি ঠিক করাইছ না ঠিক করেছ তো Glycogen content high and low, diameter small and larger. Example postural muscle, extramuscular muscles. Triangular, spiral twisted, cruciform, rhabdiform, trapezoid, quadrangular, strap with tendinous intersections, fusiform, biceps, 2 heads, triceps, 3 heads, and the digestic, 2 bellies. Morphological types of muscle based on their general form and fascicular architecture. The pennitate fasciculi. The pennitate fibers muscle resemble of the feature. Hence the name of pennitate. The fleshy fibers correspond to the bars of the feature and the tendon of the shaft as they are as inserted by tendon. The pennitate muscle have many fibers per unit area and hence they are strong muscle. There may be unipenetrate when fibers have a linear origin and have the appearance of one half of a feature. Extensor digitorum longus and flexor pollicis longus and perineus tertius bipennitate. When the arrangement of the fibers is that a whole features flexor hallucis longus and dorsal anterosy. The multipennate with septa. The extensor into the origin and the insertion. The arrangement of the fibers is such it provides the appearance of the many featured deltoid circumference. When the fibers conveys from the wall of the cylindrical space to a buried central tendon, the tibialis anterior. Name of muscle. The name of muscle can often tell you a lot about the muscle. Muscle are named according to their location, shape, action, number of heads, attachment, origin or insertion, direction of the fibers and size of the muscle. The muscle name tend to falls into one or more of the aforementioned categories. Muscle location tibialis anterior aspect of the tibia, temporalis temporal fossa, supraspinatus fossa, infraspinatus fossa, pectoralis in front of the chest pectoris, chest money pectus, intercostalis between the ribs. The penetrate muscle, unipenetrate muscle, bipenetrate muscle, multipenetrate muscle, circumpenetrate. muscle shape হচ্ছে trapezius, trapezoid shape, serratus anterior, serrated and jagged shaped anterior attachment, quadratus, quadrangular in shape, rhabdius, rhabdoidal in shape. According to the action, muscle action, extensor carpi ulnaris, extensor of the wrist corpus, flexor carpi radialis, flexor of the wrist on radial side. According of the number of heads, muscle biceps brachialis, two heads on front of the brachium, tricep brachialis, three head muscle on back of the brachium, quadricep, four head muscle on front of the femur. According to attachment, muscle attachment sternocleidomastoid on sternum, clavicle and mastoid process of skull, styloid on styloid process and hyoid bone, curicothyroid on cricoid and thyroid cartilage. According to direction of fibers, muscle and direction of fibers. Rectus abdominis straits, rectus straits muscle on the anterior abdominal wall, transverse abdominis muscle running transversely on the front of the anterior abdominal wall, rectus femoris muscle lying straight on front of the femur, extensor oblique superficial muscle have oblique fibers. According to the size of muscle, muscle size gluteus maximus, gluteus medius, gluteus minimus, largest medium, smallest muscle attached to the gluteal surface of hip bone, lateral maximum, largest medius in between the medium size and minimus spurs, adductor mangas, longest, largest, adductor mangas, largest, long, adductor longus, adductor brevis, long, short হচ্ছে brevis, muscle in the adductor compartment of the size. Gross feature of a typical anatomical muscle. Typical skeleton muscle is usually long and narrow, spine a joint and attached to a bone at either end by a tendon. It consists of two parts. When the muscle contact, one of the bone moves relative to the other joint. The more flexed or stationary attachment is designed as the origin of muscle and the movable and its insertion. In limb muscle, the origin is usually proximal to the insertion. The inspection of figure 9.9 suggested that the upper attachment is the origin and the lowest attachment is the insertion, so that one would accept that the contraction of the muscle would move the distal bone, nerve, artery, muscle belly, and nervoscapular hilum, synovial bursa, tendon insertion. Schematic diagram of the typical skeletal muscle showing origin, insertion by means of a tendon, nerve supply, blood supply, and lubricating device, synovial bursa. This arrangement can be reversed if the more mobile and become less mobile. For example, what would happen if the hands were holding on the chaining bar when the biceps contracted? The biceps will still flex the elbow, but now humerus move towards the insertion. This because the proximal bone, which is usually more stable, has become more mobile. This is termed as the reversal of the muscle action. Clinical correlation. Almost every muscle can work within the apparent origin and insertion reversed. For example, the latissimus dorsi is inserted into floor of the intertubular group of upper end of the humerus and usually described as the adductor and medial rotator of arm. But if the arm is flexed, the insertion of the muscle will act on a origin and muscle becomes most important and to the patient shifting their position in bed by placing their hands on the bed and lifting the pelvis on the new position.
Two parts. It refers to a thickened flesh part called belly and a cord-like fibrous part called tendon. The word muscle is derived from the Latin word musculus, which means little mouse, which is probably due to the fact that some muscles bear fancied resemblance to mice, with fleshy parts representing the body and tendon representing the tail. The belly is the contractile part and it generally attached to the bone that is proximal to the bone that is to be moved. It is highly vascular with higher metabolic rate. It cannot withstand pressure or friction. The tendon spans the joint and attaches to the bone that is to be moved. When tendon is flattened, it is called aponeurosis. At the myotendinous junction, the connective tissue framework of muscle belly becomes continuous with connective tissue framework of the tendon, and the muscle fibers of muscle belly are continuous but not continuous with the fiber with the tendon fibers. This arrangement at the myotendinous junction resembles the dovetail arrangement. Tendons. Sil- Salient features of tendons are as follows. The tendon is a cord-like structure formed by dense, regular connective tissue that connects the muscle belly to the periosteum of the bone. Tendons. Salient features of tendons are as follows. The tendon is a cord-like structure formed by dense, regular connective tissue that connects the muscle belly to the periosteum of the bone. It functions to transfer the force of contraction from muscle across the joint and to the bone that is to be moved. Figure 9.10 Myotendinous junction. Contiguity of muscle fiber with tendon fiber. Dovetail type of junction between belly and tendon. The patented sheet of tendons are called aponeurosis. The blood supply of tendon is derived from two sources, from the vessels of its own muscle and from the periosteal vessel of the bone to which it is attached. In many situations where the tendons are subject to friction, a lubricating device, a synovial brusa or a synovial sheath, is interposed to enable them to move freely. The synovial sheath consists of two layers, a visceral layer that covers the tendon itself and a parietal layer. The two layers are separated by a thin film of synovial fluid. The tendons serve a withstand pressure. The tendons are immensely strong. For example, a tendon across section area is 6 cm is capable of supporting a weight of 4000 to 8000 kg. The tendons are supplied by sensory nerves endings. The Golgi tendon organs are which play a role in tendon reflex. Clinical correlation rupture of tendons. If the tendon of a muscle is severed or ruptured, the muscle becomes ineffective. To access the integrity of a tendon, one must know the site of its insertion and the movement the contraction of this muscle would normally produce. The tendons are ruptured by direct trauma, especially when they are weakened by rubbing over a fractured arthritis. The tendons of bicep brachii, the Achilles tendon, and various tendons of the hands are one of the more often ruptured. The tendons have poor blood supply. Tendons have poor blood supply. So if ruptured does not heal itself, hence surgical reconstruction is generally needed for the treatment of a severed tendon. Lubricating mechanisms synovial brusa and synovial sheath.
Lubricating mechanism, synovial bursa and synovial sheath. If a muscle tendon is subject to friction, a lubricating device, a synovial bursa or synovial sheath is always interposed. Synovial bursa. A synovial bursa is a closed sac differentiated out of irregular tissue. It is similar to synovial membrane in structure. Its walls are separated from each other merely by a thin film of slippery fluid. The bursa tunnels. They are surrounded by synovial sheath. The synovial sheath extends 1 centimeter or either side of the friction. The tendon invaginates the bursa from one side so that the tendon becomes suspended within the bursa by a mesotendon, and the mesotendon enables blood vessel to either the tendon. Thus, structurally, synovial sheath is made up of the two concentric layers, parietal and the visceral, of the synovial membrane. Two layers are separated by the capillary film of synovial fluid. Where the range of movement is excessive, the mesotendon either disappear completely or may be reduced to narrow cords. The vallicula of the digital synovial sheaths around the long flexor tendons of the finger and toes. Blood supply. Muscle cells have rate of metabolic activity, hence require extensive vascularity of receives nutrients and oxygen and elements waste products. Small muscles are generally supplied by a single and perhaps two veins to return the blood. Large muscles are usually supplied by the several arteries and veins. The microscopic capillary exchange between arteries and veins occurs throughout the endomycelium, the surrounding the individual muscle fibers. Synovial sheath around a tendon passing under the fibrous band. The invagination of the synovial sheath by tendon and blood vessel reaching the tendon through the mesotendons. Synovial sheath around the long flexor tendon to the fingers. Clinical correlation. Stiffness of the muscle. The feeling of the stiffness that the day after the strenuous exercise is due to the strain on muscle fibers and the accumulation of lactic acid within the muscle. The lactic acid is the waste product of metabolism and is removed by the venous flow from the muscle. If the individual is in a good physical condition, the lactic acid is readily removed and he and she does not suffer from stiffness. Classification. তাহলে stiffness of muscle, if the individual is in good physical condition, the lactic acid is readily removed. ও আচ্ছা, lactic acid, he does not stiffer from the stiffness. তাহলে স্টিফনেসের জন্য আগে তোমার এক্সারসাইজের দরকার সবচেয়ে বেশি। ক্লাসিফিকেশন অফ দি মাসেল অ্যাকর্ডিং টু ভাস্কুলার পেডিকলস. Muscle are classification into 5 types according to the number of the vascular pedicles which enter the muscle and either relative nuances. Type 1, type 2, type 3, 4, 5. Type 1. These muscle possess a single vascular pedicle. Tensor fasciality supplied by the ascending branch of the lateral circumference femoral artery and the gastrocnemius supplied by the sural artery. Type 2. These muscle possess single dominant vascular pedicles and several minor vascular pedicles. Glacialis supplied by the medial circumference artery in the dominant pedicles. Type 3. These muscle possess two separate dominant pedicle from the different surrounding arteries. The radius rectus abdominis supplied by the superior inferior gastrointestinal and applied by the superior inferior gluteal arteries. Type 4.
Nerve supply enter the muscle at one or more nerve vascular hilli, figure 9.9, which are fairly constant in location. The knowledge of location of these hilli is important to physiotherapists, since they are the points at which cardiac stimulation of the nerve is more effective. Generally, the nerve supplying the muscle is motor nerve, but strictly speaking, it is a mixed nerve, i.e., it contains both motor and sensory fibers. The motor fibers conduct nerve impulses to motor fibers to stimulate them to contract, where the sensory nerve fibers conduct impulses away from neuromuscular spindles in the muscle and Golgi nerve endings in the tendon of the central nervous system (CNS). Note well. Muscle fibers will atrophy if they are not periodically stimulated to contract. Further details: motor fibers 60%, supplying the muscles are of two types: large myelinated alpha fibers, which supply extrafusal muscle fibers of muscle spindles; small myelinated gamma fibers, which supply intrafusal fibers of muscle spindles; sensory fibers 40%, supplying the muscles are of two types: myelinated fibers carrying proprioceptive sensations from muscle to spindle to tendons. Note well, muscle fibers will atrophy if they are not periodically stimulated to contract. Further details: motor fibers 60%, supplying the muscles are of two types: large myelinated alpha fibers, which supply extrafusal muscle fiber to muscle spindles; small myelinated gamma fibers, which supply intrafusal fibers of muscle spindles; sensory fibers 40%, supplying the muscle are of two types: myelinated fibers carrying proprioceptive sensations from muscle spindles and tendons; non-myelinated muscles carrying extraceptive pain, touch, and temperature sensations. The relative size of nerve supplying a muscle depends upon the size of the motor units in the muscle. Motor point: it is the point of entry of nerve trunk into the muscle. The nerves mostly enter the muscles from their deep surfaces, with few exceptions such as long thoracic nerve supplying serratus anterior muscle from its superficial surface. The motor points corresponds to nervovascular hilum. Motor unit: a motor unit consists of a single motor neuron as anterior horn cell, its axons, and all the muscle fibers that it supplies. The muscles that have precise and accumulative controlled action, for example, extravascular muscle, small muscle motor units, which an innervation ratio of 1 to 10, but muscles that can generalize functions across body movements, such as those in gluteal regions of thigh, have very large motor units with an innervation ratio exceeding 1 to 500. Neuromuscular junction, the junction between the terminal end of axon motor and plate, the sarcolemma of a muscle fiber, sole plate, is called neuromuscular junction. When a motor a nerve when a motor nerve penetrates a muscle, it divides into number of branches or axons. The terminal end of axons contracts the sarcolemma of muscle fiber. The axon may branch to a serve a number of muscle fibers. Motor end plate: it is the extended terminal end of axon, also called presynaptic terminal. It is not covered by swanseth, as the terminal part of the nerve fiber loses myelin sheath, and such one sheath spreads over the surface of sarcolemma. The sympathetic terminal contains numerous small synaptic vesicles containing neurotransmitters called acetylcholine (ACH). 9.13 Motor unit: it consists of a single motor neuron and all the muscle fibers that it innervates. Most muscles have an innervation ratio of 1 motor neuron per 100 to 150 muscle fibers. Muscles capable of precise movements have an innervation ratio of 1 to 10, whereas muscle responsible for gross body movement have an innervation ratio exceeding 1 to 500. Soul plate. The sarcoplasm underneath the sarcolemma, which is in contact with motor and plate, contains many muscle nuclei and mitochondria and forms the soul plate. The sarcolemma is thrown into numerous folds, forming subneural cleft, synaptic cleft, neuromuscular cleft. It is a small gap between plasma members of axon terminal, presynaptic membranes, and plasma membrane of sarcolemma, postsynaptic membrane. Mechanisms of transmission of impulse. As the nerve impulse reaches the axon terminal, it causes the release of acetylcholine into the synaptic cleft of the neuromuscular junction, which soon binds with the receptors on the postsynaptic membrane, leading to its depolarization, i.e., production of an action potential, and consequently, the muscle contracts. As the action potential is produced, the muscle contracts. The acetylcholine is immediately destroyed by an enzyme called acetylcholinesterase, present in high concentration on the motor and plate. Clinical correlation. When a nerve fiber is cut, the nerve terminal degenerates with soul plate persists for a year or so. When the nerve fibers regenerates, a new motor plate is formed. In organophosphorus poisoning, a commonly ingested poison to commit suicide. The organophosphatase binds with and inhibit the action of ACHE and acetylcholine E. As a result, the acetylcholine is not destroyed in the synaptic cleft, leading to continuous production of action potential and contraction of muscle. For example, respiratory muscle, consequently, the occurs spastic paralysis of respiratory muscles and death. Myasthenia gravis results from production of autoimmune antibodies that bind to acetylcholine receptors on postsynaptic membrane and destroy them, thus reducing their number. Therefore, when they are activated by the acetylcholine, the muscle cannot contract properly and exhibit a degree of flaccid paralysis. The acetylcholine receptors are also blocked by a poison called curare. Fortunately, curare is not a common poison to which people are exposed.
Neuromuscular spindle muscle spindles. There are spindle-shaped sensory and organs within the skeletal muscle which provide sensory information to the CNS to control the tone of the muscle. Each spindle consists of bundle of small specialized skeletal muscle fibers surrounded by a fusiform connective tissue and tissue capsule. These fibers are called the intrafusal fibers. The unspecialized muscle fiber outside the spindles are called the extrafusal fibers. Muscle fibers are of two types: nuclear chain fibers and nuclear wave fibers. In nuclear chain fibers, the nuclei form a single longitudinal chain in the central unexpanded part, whereas in the nuclear back fibers, nuclei are arranged aggregated in the central expanded region. The extrafusal fibers are supplied by the large alpha motor fibers, whereas the intrafusal fibers are supplied by the small gamma motor fibers. The sensory innervation of the muscle spindle is by two types: sensory nerve findings, neurospiral flower spray. The neurospiral nerve ending wind spirally the central muscle region to the interfusal muscle fibers. The flower spray nerve endings terminate at the end of the interfacial fibers away from the central nuclear region, resembling a spray of the flowers. The nuclear back fibers are thicker and longer than the nuclear chain fibers and project beyond the spindle-shaped fibers capsule to the attached within the extrafascial connective tissue. Stretch reflex. When the muscle is stretched, its intrafascial muscle fibers are elongated, thus stimulating the sensory nerve endings around them. The sensory nerve fibers carrying the information synapse with alpha and motor neurons, which in turn causes the quick contraction of the stretched muscle fibers. The stretch reflex thus reducing tension in the intrafascial fibers. Muscle spindles regulate the degree and the rate of the contraction of the extrafascial fibers. The stretch reflex is used by the clinician to elicit the tendon jerks. Golgi tendon organs, neurotendinous spindles. These are sensory organs located near the musculoskeletonous junctions. They monitor the tension produced and tendon during muscle contraction and prevents its damage from excessive stress put on it. তো দেখো এখানে 24 symmetric structure of the neuromuscular spindles, its nerve supply. Golgi tendons organ reflects the Golgi tendons organs give rise to differs which end of the inhibitory intertendons. Flexing the elbow joint are supplied by the cervical 5-6 spinal segments, and muscle extending the elbow joint are supplied by the cervical 7-8 spinal segments. It is neither necessary for nor possible to resemble mental innervation of the muscle, but students should remember the segmental innervation of the muscles, which are tested clinically by reciting tendon charts of patients. The segmental innervation of this muscle is given in table 9.4. Correlation একটুখানি করে আমি এরপর বললাম
Clinical correlation paralysis of muscle. The loss of motor power, i.e., power to produce movement, is called paralysis. It occurs due to damage of motor pathway consisting of upper and lower motor neurons. Damage of upper motor neurons causes spastic paralysis with exaggerated tendon jerks, whereas damage of lower motor neurons causes flaccid paralysis with loss of tendon jerks. Action of muscles. When muscles contract, it brings about a movement. The range of movements depends on the length of the of fibers in the fleshy part and power generated during contraction. Muscle tone. It refers to the intention, content, tension produced by muscles for long periods of time. Muscle tone is responsible for keeping our back and legs straight. The muscle tone is maintained by a small percentage of motor units. The motor units that are contract, contracting are stimulated in such a way that tension produced in a muscle remains constant. Note well, the same motor units are not contracting all the time. Length tension relationship in muscle. The tension refers to the force built up with the muscle, which is necessary for a muscle to contract. Strengthening a muscle builds up tension within the muscle, which is released when the muscle contracts. A muscle is capable of being shortened or one half of its normal resting length. It also, the muscle can be straightened twice as far as it can be shortened. The extrusion of a muscle is the distance between maximum elongation and maximum shortening. The action of muscle is strongest when it is slightly stretched. Types of muscle contraction. Muscle contraction are of the following types: isomeric contraction, disomeric contractions. The length of muscle does not change, but the tension does increase. For example, holding the arm outstretched. Isotonic contractions. In isotonic contractions, the amount of tensions produced by the muscle is constant during contraction, by the length of the muscle changes. The length of muscle is reduced by 1/3 or more. For example, movement of fingers and hands. Concentric contractions. The muscle produces increasing tension as it shortens. A large percentage of movements produced by muscle contractions are concentric contractions. Eccentric contractions. In eccentric contractions, the tension is maintained in muscle while muscle increases in length. For example, lowering the arm to the side of the body. Segmental nerves of muscles commonly used for eliciting tendon jerk reflections. Biceps brachii, C5, C6, musculocutaneous nerve. Triceps brachii, C6, radial nerve. Brachioradialis, C5, C6, radial nerve. Quadriceps femoris, I2, I3, I4, formal nerve. Triceps sori, SI, S2. Tendon jerk, ankle jerk, knee jerk. Length of muscle, resting state, concentrated state, stretched state. Active and passive insufficiency of muscle. In muscles acting as a joint, the extrusion of muscle will be greater than the range of motions allowed by the joint. However, for muscles acting on two or more joints, the muscle extrusion is less than the combined range of motion allowed by the joints. active insufficiency. When muscle reaches a point where it cannot shorten further, it is termed as active insufficiency. It occurs in the agnostic muscle that is contracting. Passive insufficiency. When muscle cannot be elongated any further without damage to its fibers, it is termed as passive insufficiency. It occurs in the antagonistic muscle that is relaxed during a movement and is on the opposite side of a joint. Think of how much you are hurt when slapped with a loose and strained hand by a teacher. Passive insufficiency and active insufficiency. Active insufficiency when muscle reaches a point where it cannot be shortened further. It termed as active. It occurs against muscle contracting. Passive insufficiency when muscle cannot be elongated any further without damage to its fibers. It is termed as passive insufficiency. It occurs in antagonistic muscle that is relaxed during a movement and it is on the opposite side of a joint. Group action of muscles.
The group action of muscle, with a few exceptions, a single muscle does not contract alone. Whole abdomen, rather than individual muscle, are represented in the cerebral cortex. Therefore, each movement requires the contraction or relaxation of a whole group of muscle. Further, each movement is brought about by a coordinate activity of differentiate group of muscle. These muscle groups are classified according to the role played by them in the occurrence of the particular action. The prime moves agonist. These muscles are primarily responsible for producing desired movement. Biceps brachii is acting on a prime mover within produce flexion at the elbow joint, and prime movers simply bring the insertion near its origins. Diagram to show the prime mover and antagonist muscle for flexion at the elbow. Biceps brachii muscle act as the primer mover, whereas the tricep brachii act as the antagonist at the same joint. During extension, triceps act as a prime mover and biceps act as an antagonist. Antagonistic and antagonist is the muscle which is able to produce movement opposite to the prime mover. Usually, however, the two muscle agonist and antagonist act in union, so that when the prime mover contracts, each an antagonist undergoes a simultaneous relaxation. In this way, an accurate, controlled movement is carried out. In flexion of elbow, the biceps act as a prime mover, while the tricep pays out and act as an antagonist. This muscle reverse role of course in extension of elbow. This is possible due to the reciprocal innervation of opposite group of muscle regulated by the spinal cord through the stress flexors. A muscle is said to act as a flexator when its contraction to stabilize the origin of the prime movers, that it can act efficiently. Muscle attaching the shoulder girdle, the trunk contact as flexion to elbow the deltoid to act the shoulder joint to produce abduction. The synergistic, when the prime mover crosses more than one joint to reach the joint where action takes place, the undesired movement of the proximal joint is prevented by the certain muscle known as the synergist. The long flexion of fingers cross over the wrist joint and can flex it, but its movement is disadvantage if it is desired to reach the total number of muscle in the body all in the about 400. Total number of cell body হচ্ছে 400. All the muscle body develop from the mesenchymal except the erector pili muscle of the iris myoepithelial cells which develop the ectoderm. Largest muscle in the body gluteus maximus. Longest muscle of the body sartorius spine muscle. Smallest muscle of the body stapedius. Most important property of the muscle contractile. Most abundant muscle type of the body skeletal muscle. Functional contractile unit of the muscle motor unit. Functional unit of the muscle fiber sarcomere. Most variable muscle in the body হচ্ছে palmar longus in the forearm. Longest tendon in the body plantaris. Longest tendon of the body Achilles tendon of the calcaneus. Most important reflex for maintaining the health of a muscle stress reflex. Most commonly used muscle for the intramuscular injection deltoid in shoulder region. Muscle with smallest motor unit extraocular muscle with the largest motor unit. Muscle of the lower limb gluteus maximus. Most common inflammatory movement of the skeletal muscle myokymia. Most commonly ruptured tendon in the body tendocalcaneus. Most differentiate muscle in the body cardiac muscle. All the muscle need nerve stimuli to the contact
except cardiac muscle, which can contract without nerve stimulus. Myogenic contraction. Most common type of muscle contraction concentric contractions. Type of muscle fibers most suited for long distance running. Slow switch fibers, red fibers. Since there are fabric stimulations of nerve most effective nerve points. In most of the muscles of the body, the nerve enters in its deep aspect, except serratus, anterior, in which the nerve enters its superficial aspect. Skeletal muscles can repair themselves to some extent due to proliferation of subtle cells which fuse to the new skeletal muscle fibers. Damaged cardiac muscle, for example, myocardial infarction, is replaced by fibrous tissue because cardiac muscle repair its non-existence, for it does not contain subtle cells. Type of muscles, the highest regenerative capacity is smooth muscles. The skeletal muscle present all of the following features except its actions are involuntary. All of the following muscles have pennate facility except trapezius. Regarding stretch reflex, all of the following statements are true except it regards the rate of contraction of intrafusal fibers. In the movement of flexing of the elbow joints, the biceps brachii act as prime mover. All of the following features regarding red muscle fibers are true except have a few mitochondria. The muscles capable of highly dexterous movement contain one motor unit per muscle fiber. Select the incorrect statement about the tendon. It heals quickly if ruptured. In cleansing the first, which of the following muscles act as synergist extensor of the wrist? Cardiovascular system. Chapter 10. Learning objectives. After studying this chapter, the student should be able to define cardiovascular system and enumerate its functions. Introduction. The cardiovascular system consists of heart and blood vessels. The system supplies nutrients to and remove waste products from various tissues of the body. The conveying medium is blood, which flows through tubular channels called blood vessels. It is thus a closed system, and blood in it serves as a medium for transporting of various agents such as nutrient, O2, CO2, etc. The heart pumps the blood and provides the major force that causes the blood to circulate, whereas blood vessels carry blood to all the tissues of the body and back to the heart. In addition, the blood vessels participate in the regulation of the blood pressure. The vessels which carry the blood away from the heart are called arteries, while the vessels which bring back the blood to the heart are called veins. The microscopic vessels connecting the arteries and the veins are called capillaries. These vessels allow easy exchange of nutrients, metabolites, and respiratory gases O2 and CO2. Functions of cardiovascular system. The cardiovascular system performs the following functions: transport nutrients to different parts of the body, removes waste products and metabolic from organ and tissue of the body, is responsible for gaseous exchange in the lungs, i.e., intake of O2 and elimination of CO2, carries hormones and other regulatory molecules from their site of origin to distant target tissue, helps to protect by leukocytes and their products the body from infection. Component of cardiovascular system comprises blood, heart, blood vessels. Blood is taught in detail in physiology. At the same time, it is important to have some knowledge of blood before discussing the other components of cardiovascular system. The blood is a highly specialized connective tissue consisting of blood vessels and plasma. Blood cells. The blood cells are of three types: erythrocyte, leukocyte, and thrombocyte platelets. Figure 10.1. Arteries of the body. Erythrocytes. The erythrocyte red blood cell RBCs are dish-shaped cells that lack nuclei and mitochondria. They get energy from an anaerobic absorption and transport O2 and CO2. Leukocytes. The leukocytes white blood cells are of two types: granulocyte, i.e., they have granules in their cytoplasm; agranulocyte, i.e., they do not have granulocytes on their cytoplasm. The types of granulocytes: neutrophils. They are called neutrophils because their granule have no affinity either to eosin, pink or red stain, to hematoxylin, blue to purple stain. They have multilobed nuclei and have an important role in phagocytosis of bacteria and dead cells. They thus impart natural innate immunity. Neutrophils are the first to arrive at an area of tissue damage. 2. Eosinophil. They are so called because their granules stain with eosin. They have bilobed nucleus. They play a role in reducing the severity of allergies reaction by secreting histamines. Their level in blood increases in allergic reactions. For example, eosinophilia, basophil. They are so named because their granules stain blue with hematoxylin. They release anticoagulant heparin, histamine, and 5-hydroxytryptamine. Basophil play a role in immediate type 1 hypersensitivity reaction, anaphylactic reaction, causing allergic rhinitis, asthma, urticaria, and anaphylaxis. Figure 10.2. Veins of the body. Types of agranulocytes. Monocyte. They are phagocyte cells and member of monocyte macrophage system. They respond to inflammation by leaving the peripheral blood to enter the tissue and called macrophages. Lymphocytes. They are only slightly larger than RBC. The nuclei nearly fills the cells. Lymphocytes are of two types: B lymphocytes, T lymphocytes. B lymphocytes different, differentiate in bone marrow. In response to antigen, they proliferate and produce plasma cells that secrete immunoglobulin M, and immunoglobulin D. The B cells, plasma cell, and immunoglobulins are the basis of humoral response. T lymphocytes are the lymphocytes which mature and become immunocompetent in the thymus and then enter the blood to reach the lymph nodes and spleen. Clinical correlation: basis of immunization. During fetal development, B lymphocytes differentiate in bone marrow, mature or virgin. Cells express antigen-specific immunoglobulin M and immunoglobulin D on the cell surface. Mature D cells migrate to the spleen, lymph nodes, and gut-associated lymph tissues and wait for antigen exposure. When exposed to antigen, they differentiate into plasma cells which produce antibodies, immunoglobulins. B cells, plasma cells, and immunoglobulins together constitute the humoral response. B memory cells are programmed to react to the same antigen. Upon re-exposure to that antigen, it results in faster immune response called secondary immune response. The immunoglobulins secreted by a B memory cell have higher affinity for antigen than the produced during the initial exposure. This is the basic of immunization. Thrombocytes, platelets. These are in fact fragments of large cells of megakaryocytes found in the bone marrow. The platelets play an important role in blood clotting. They constitute the major portion of the mass of the clot. Platelets that attach together in the blood clot also releases a chemical called serotonin, which causes constriction of blood vessels, thus reducing the flow of blood into the injured area. Plasma. The plasma is the fluid portion of the blood. 90% of it is made out of water and the remaining is made out of proteins, inorganic salts, lipids, etc. There are three types of plasma proteins: albumins, globulins, and fibrinogens. Albumins. They are produced in the liver and provide necessary viscosity in the blood to maintain and regulate blood pressure. Globulins. They are of three types: alpha globulin, beta globulin, and gamma globulin. These alpha beta globulins are synthesized within liver and transport fat and lipid soluble vitamins. The gamma globulins are produced in lymphoid tissue and are called antibodies. They play an important role in immunity. Fibrinogens in synthesized in liver and plays an important role along the thrombocytes in the clotting of blood. Note well, if fibrinogens is removed from plasma, it is called serum. Clinical correlation: the blood can also serve to transport disease-causing bacteria, viruses, and other toxins. However, drugs given to treat the disease are also transported through blood. Heart. The heart is a four-chambered hollow muscular organ, roughly of the size of a clenched fist. It is situated in the thoracic cavity between the lungs. About two-thirds of the heart is located on the left of the middle and one-third of the right of the middle. The heart is enclosed in serous sac, serous pericardium, which in turn is enclosed in a dense fibrous connective tissue called fibrous pericardium. The serous pericardium consists of inner visceral and outer peritoneal layer with a potential cavity between the two layers called pericardial cavity. The heart acts as a central muscular pump, about 5 liters of blood per minute. It takes about 1 minute for the blood to reach the most distal part of the body and back to the heart. Weight of the heart: 310 grams in the adult males, 255 grams in adult females. Wall of the heart: the wall of the heart consists of three distinct layers from superficial to deep. These are epicardium, made of visceral pericardium; myocardium, made of cardiac muscle; endocardium, made out of endothelial cells. It is continuous with the endothelial lining of blood vessels. Chamber of the heart: the anterior of the heart is divided into four chambers: right and left anterior and right and left ventricles. Right and left atria are above and right and left ventricles are below. Each atrium has an ear-shaped afferent called an auricle. The atria are separated from each other by entirely entirely septum, while ventricles are separated from each other by intraventricular septum, base of the heart. It lies opposite to middle four thoracic vertebra in sponic position. Right one-third of the base is formed by right atrium and left two-thirds of the atrium. The atrium are receiving chambers, whereas the ventricles are pumping chambers. The right atrium receives the deoxygenated blood from the systemic circulation through the superior and inferior vena cava. Blood from the right atrium passes through right atrioventricular valve, atriocuspid valve, into the right ventricle. The left atrium receives the oxygenated blood from pulmonary circulation. Through four pulmonary veins, blood from left atrium passes through right atrioventricular valve, mitral valve or bicuspid valve, into the left ventricle. The right ventricle contracts to pump blood into the lungs through pulmonary trunk and pulmonary arteries. The left ventricle contracts to pump blood into the rest of the body through aorta and its branches. Effects of the heart: it is cone-shaped lower and outer end of the heart formed by the left ventricle. Functions of the heart: the heart functions as a double pump. The right half of the right half of the heart receives deoxygenated blood. For example, blood in low in oxygen and pumps it to the lungs through pulmonary trunk and pulmonary arteries. The left half of the heart receives oxygenated blood, for example, oxygen-rich blood from the lungs, and pumps it to the rest of the body through aorta and its branches. Thus, heart regulates two circuits of blood flow, pulmonary and systemic. Note well, on average, heart beats about 70 times in males and 75 times in females. Normal heart rate in infants: 130 to 150 per minute; in children, 100 to 130 per minute; in adults, 60 to 90 per minute. Artery supply: the artery is supplied the heart is supplied arterial blood by the right and the left coronary arteries, which arise from ascending aorta immediately above the aortic orifice of the heart. The coronary arteries receive about 5% of the blood pumped from the heart, although the heart comprises only a small portion of the body weight. The large blood supply, especially to the left ventricle, keeping with the is in keeping with the importance of the heart to the left to the body function. Note well, the coronary arteries are unique in the sense that they are filled during diastole. Clinical correlation: angina pectoris. If coronary arteries are narrowed, there will be reduced blood and O2 supply in cardiac muscles. As a result, individual feels pain in his or her left peritoneum, pericardium, medial side of arm and forearm. The pain typically occurs on exertion and relieved by rest. This clinical condition is called angina pectoris, myocardial infarction. If coronary arteries are blocked, there will be myocardic ischemia leading to cellular necrosis. This clinical condition is called myocardial infarction to heart attack. It typically occurs at rest and pain lasts longer than 10 minutes. Heart attack. These are one of the most common causes of death these days. The risk of attack can be minimized by reducing excess weight, avoiding blood pressure, hypertension, taking low cholesterol diet, avoiding smoking and doing regular exercise. Venous drainage. The venous blood from heart is drained into the coronary sinus through great middle and small cardiac veins. Posterior vein of left ventricle, oblique vein of left atrium and right marginal vein. The coronary sinus in turn opens into the right atrium. The other small veins, also called venae portae minimi or Thevesian veins, directly drain into the chambers of the heart nerve supply. The heart is supplied by both sympathetic and parasympathetic fibers. The stimulation of sympathetic fibers results in increase in heart rate and force of contraction of heart rate. The stimulation of parasympathetic fibers, vagus nerve, results in decrease in heart rate and force of condition of the heart. Note well, all the cardiac branches of sympathetic chain and vagus nerve contain both sensory and motor fibers except the cardiac branch from superior cervical sympathetic ganglion, which contain only postganglionic motor nerves. Conducting system of the heart. The cardiac muscle has property of being stimulated automatically by its own conducting system formed of cardiac fibers which are specialized for initiation and conduction of cardiac impulse. This phenomenon is known as automaticity. The automaticity of heart is further regulated by nerve impulses from brain or circulatory metabolism and hormones either increase or decrease the heart rate. Conducting system of heart consists of following components. Sinoatrial node ascent. It is located on the right atrium in the upper part of the sulcus terminalis. It initiates impulse, hence it is also called as a pacemaker of the heart. Atrioventricular AV node. It is located in the lower part of the atrial septum. It is also generate impulses but at a slower rate than SA node. Atrioventricular bundle. It connects atrial and ventricular musculature. Right and left bundle branches. They are located in the muscle part of intraventricular septum. Purkinje fiber. They are terminal branches of bundle branches. Note well, cardiac muscle can contract without nerve stimulus, myogenic contraction, whereas the muscles of the body need nerve stimulus to contract. Blood vessels. The blood vessels form a closed system of tubes that carry blood away from the heart to the tissue of the body and then return back to the heart. The blood vessels include arteries, capillaries, and veins. Arteries, distributing channels, are thick-walled tubes that carry blood away from the heart. The blood leaving the heart passes through the vessels of progressively smaller diameters referred to as arteries and arterioles. Figure 10.6. Conducting system of the heart, page 272. Textbook anatomy, upper limb and thorax. Note well, the word artery meaning air tube, artery meaning air tube, was first used by Aristotle because of depth. When rigor mortis passes over, the liquid blood is controlled in the dilated veins and arteries become empty. Sometimes air bubbles appear within arteries due to decomposition. Capillaries are microscopic vessels that connect arterioles and capillaries are arterioles and venules, veins, draining channels. There are thin-walled tubes that carry blood from tissue to different parts of the body back to the heart. The blood returns to the heart from the capillaries, passes through the vessels of progressively large diameters, termed as veins and venules. Note well, except for the capillaries and the venules, the blood vessels walls consist of three layers. Classification of blood vessels: conducting vessels, distributing vessels, resistance vessels, exchange vessels, capacitate or reservoir vessels. Arteries, general macroscopic structure: tunica intima, tunica media, tunica adventitia. Clinical correlation: arteriosclerosis, a hard or hardening of the arteries. It is the age-related progressive generalized degenerative disorder of arterial walls, usually seen after the middle age. There is generally a slow loss of electricity and thickening of tunica intima due to increase in collagen and accumulation of lipid. Consequently, it leads to diffuse narrowing of lumen of blood vessels. Ischemia of the tissue supplied by affected arteries occurs in lower limbs. It is seen in the form of intermittent coordination, characterized by pain, weakness in muscle at work, especially during work, that is almost immediately revealed by the rest. In the brain, it's seen in the form of mental function. Atherosclerosis. It is an atherosclerosis in which plaques, patchy accumulation of lipid, fibrous tissue, and macrophages called atheroma accumulate in the tunica intima, which makes the lumen surface of the artery uneven that can initiate the formation of black clot called a thrombus, which may occlude the lumen. For example, if it occurs in coronary artery, it may lead to myocardial infarction, heart attack. Note well, an embolus is an thrombus that is dislodged from the wall of the vessel and moves in the bloodstream. Both thrombus and embolus can occlude flow. An embolus lodged in the coronary artery, coronary embolism, is called coronary thrombus in a vessel of lung. It is called pulmonary thrombus, and in a vessel of brain it is called cerebral thrombus. Classification: functionally, arteries are classified into three types: elastic arteries, elastic; conducting arteries, muscular; distributing arteries, arterial; resistance vessels. Note well, there is a gradual change in the diameter thickness of the wall amount of elastic tissue and muscular tissue in the wall from a larger size elastic arteries to muscular arteries to arterioles. Elastic arteries, conducting vessels, are large arteries arising from the heart and their main branches, i.e., aorta, branching phallic trunk, common carotid artery, and the subclavian artery. They are called elastic arteries because tunica media of these arteries is predominantly made out of elastic fiber. They are so called conducting vessels as the main function of is to con- conduct blood from the heart to the muscular arteries. Mus- Muscular arteries distributing vessels are medium sized arteries supplying individual organs and various parts of the limbs, i.e., renal, testicular, uterine, radial, posterior, and anterior tibial arteries, etc. They are also distributing vessels. There is gradual change from elastic to muscular arteries. The elastic material decreases and muscular tissue becomes the main constitution of tunica media 75%. These arteries regulate the flow of blood to an organ or part, as the smooth muscle of tunica media can alter the size of its lumen by contraction or relaxation. Arterioles are the smallest divisions of the muscular arteries with 100 mm or less in diameter. Their narrow lumen is surrounded by abundant muscle tissue. They are the main source of peripheral resistance to the blood flow. Hence, they are also called resistance vessels. They play an important role in the regulating the diastolic blood pressure. As the arterioles progressively divide into smaller branches, their walls become thinner and from successively terminal arterioles and meta-arterioles.
Arterioles at their arterial end have all the three courts. Arterial and large arterioles, terminal arterioles 15 to 20 mm in diameter, are devoid of internal elastic lamella and have continuous coat of muscle cell arranged in one or two layers. In meta arterioles, smooth muscle are replaced by the discontinuous non-contractile cell called the pericytes or rugate cells. The meta-arterioles terminate into capillaries in vascular beds. A meta-arteriole is directly connected with the venule by a thoroughfare channel or preferred channels, and the capillaries take origin as side branches of the thoroughfare channel to form the capillary network. The entry of blood through the capillary is regulated by the precapillary sphincters. এই যেখানে দেখো ছবিগুলা, স্ফিংটার রিল্যাক্সেশন, আর্টারিউ অ্যান্ড দি ক্যাপিলারি নেটওয়ার্ক, এই ছবিটাও কিন্তু আসে, লিখতে হয়। এটা
Figure 10.8 Thoroughfare channel. Note well, blood flow through the thoroughfare channel bypasses the capillary bed blood supply of the arteries. Tunica adventitia and outer two-thirds of tunica media are supplied by vasa vasorum. Tunica intima and inner one-third of tunica media are supplied by luminar blood through diffusion. Minute veins accompanying arteries drain the blood from the arterial wall. Lymphatic are also present in the tunica adventitia. Note well, vasa vasarum nutrient vessel supply only large arteries and some medium sized. Note well, vasa vasorum nutrient vessel supply only large arteries and some medium sized arteries more than 1 millimeter in diameter. They form this dense capillary plexus in the tunica adventitia and may penetrate up to the middle of the tunica media. Clinical correlation: syphilic aneurysm, syphilitic aneurysm. The vasa vasorum are involved in tertiary syphilis, leading to poor blood supply of the tunica adventitia and other two-thirds of tunica media. As a result, these layers undergo ischemic degeneration. Consequently, weakness of these layers lead to syphilic aneurysm. Nerve supply.
Are most supplied by the non-myelinated sympathetic nerve fibers called the nervi vasorum and nervi vascularis. The sympathetic fibers supply arteries generally cause the constriction of the smooth muscle in the wall of arteries, except in heart, brain, and skeletal muscle, where they cause the vasodilatation. A few myelinated sympathetic fibers also supply the arteries. They are said to be the sensory in nature, pain sensation, feeling of the arteries. All the arteries are filled with blood during the systolic except coronary arteries supplying heart, which are filled during diastole. Arterial pulse, the force exerted by blood against the vessel is called the blood pressure. Normal blood pressure of an adult is above 120 to 80 mm mercury. 120 standards for systolic pressure and 80 standard for the diastolic pressure. The systolic pressure results due to the contraction of the heart during ventricular systole, whereas the diastolic pressure results due to the contraction of the smooth muscle of the arterial wall. Difference between the systolic and diastolic pressure is called the pulse pressure. The pulse is palpable impulse of pressure wave of blood flow initiated by the ventricular systole. Clinical correlation. Sites where the arterial pulse is routinely palpated, a pulse is palpable impulse of pressure wave of blood flow initiated by the ventricular systole. The student must know the sites where the arterial pulse is routinely palpated by the clinicians. These 7 sites are listed in the table 10 to the power 2 and listed in figure 10.9. The Table 7 routinely palpable site of the arterial pulse: carotid, brachial, radial, femoral, popliteal, posterior tibial and dorsalis medialis. Carotid, along with the anterior border of the sternoclavicular muscle, carotid এখানে দেখো carotid pulse এখানে পাওয়া যায় along the anterior border of the sternocleidomastoid muscle in the neck at the level of the carotid cartilage. Brachial এখানে medial of the tendon of the biceps brachii in front of the elbow. তারপর হচ্ছে radial side in front of the forearm at wrist lateral to the tendon of the flexor carpi radialis. Femoral, below the inguinal ligament midway between the pubic symphysis and the superior iliac spine. Popliteal, behind the knee is the popliteal fossa. Posterior tibial, medial side of the ankle midway between the medial malleus and tendinocalcaneus. The dorsalis pedis, over the dorsum of the foot just medial to the tendon of the sternum helicus longus. The assessment criteria, এখন তোমার হচ্ছে carotid arteries, এটার অ্যাসেসমেন্ট ক্রাইটেরিয়া হচ্ছে মোস্ট রিলায়েবল পালস ইন দি ফিজিওলজিক্যাল শক অর কার্ডিয়াক অ্যারেস্ট ওয়েন পালস অ্যাট দি আদার সাইড আর নট প্যালপেবল। তারপর হচ্ছে তোমার ব্র্যাকিয়াল, medial to tendon of the biceps brachii in front of the elbow to auscultate the blood pressure, এটার হচ্ছে ব্র্যাকিয়াল পালস। তারপর হচ্ছে radial site in front of the forearm at the wrist lateral to the tendon of the flexor carpi radialis, most commonly felt pulse to assess the character and rate of the pulse. Femoral, below the inguinal ligament midway between the pubic symphysis and the anterior superior iliac spine to locate the femoral vein for venopuncture which lies just medial to it. Popliteal, behind the knee of the popliteal fossa to assess the status of the circulation of the lower limb. তারপর হচ্ছে posterior tibial, medial side of the ankle midway between the medial malleolus and the tendon calcaneus to assess the status of circulation of the foot. তারপর হচ্ছে dorsalis pedis, over the dorsum of the foot just medial to the tendon of the extensor helicus longus to assess the status of the circulation of the foot. আদিত্য নামে
Figure 10.9, 7 site when arteries plus are routinely palpated. 7 sites where arterial pulses are routinely palpated. 1. Carotid. 2. Branchial. Brachial. Carotid. Brachial. Radial. Femoral. Femoral. Popliteal. Popliteal. Posterior. Dorsal. Dorsal pedis. Dorsal.
Severe lung disease.
Capillaries. The capillaries are thin-walled and endothelium-lined thin microscopic vessels that connect arterioles and venules. There are over 40 billion capillaries in the body with extensive network of vessels almost in every tissue of the body. The fact that the capillaries provide a total sum area of 1000 square kilometer miles from exchange between blood and tissue fluid. The average diameter of capillaries is 6 to 8 millimeter, as the diameter of erythrocyte is about 7 millimeter. Only one erythrocyte passes at a time. Thus, RBC passes through a capillary in a single file. Unlike the vessel of the arterial and venous system, the walls of capillaries are made out of only one cell layer of a squamous epithelium called endothelium. Note well, the flow of blood through capillaries is called microcirculation. Types. According to the nature of endothelial lining, the capillaries can be classified into the following two steps. 1. Continuous capillaries, fenestrated capillaries. In continuous capillaries, the endothelial cell from a continuous tube. The cells are held together by tight junctions. The main feature of continuous capillaries is the pinocytic vessel in endothelial cell. This indicates that transport of material takes place through the cytoplasm of endothelial cells and may account for selective nature of transport sites. Continuous capillaries are found in skin, muscle, lung, and brain. Fenestrated capillaries are characterized by the wide pores between the endothelial cells. These pores are closed by a layer of microprotein called diaphragm. 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 The diffusion of substance takes place through these diaphragms. Sites. Fenestrated capillaries are found in pancreas, endocrine glands, interstitial villi, choroid plexus, ciliary process of eye, etc. Note 12. The general glomeruli have fenestrated discontinuous capillaries, but pores are not closed by diaphragms. Sinusoids. The sinusoids are large irregular vascular spaces with connective arteriole with venule or venule with venule with venule. They replace capillaries in certain organs such as liver, spleen, bone marrow, suprarenal, suprarenal glands, parathyroid glands, etc. The lumen of sinusoid is regular and wide, about 30 to 40 millimeter in diameter. The walls of sinusoid are thin and made out of endothelial cells with large pores or sites which made of endothelial which are not closed by diaphragms. The wall of sinusoid may be incomplete and contain phagocyte cells. For example, sinusoid in liver contain Kupffer cells which remove bacteria and other foreign particles from the blood. The sinusoid are closely surrounded by the parenchyma of organ functions. Due to irregular lumen, the flow of blood is sluggish in sinusoid that allows sufficient time for exchange of substances. Between blood and tissue fluid, the difference between capillaries and sinusoid are highlighted in table 10.3.
And endothelium lined, thin microscopic vessels that connect the arterioles and the venules. There are over 40 billion capillaries in the body with extensive network of vessels almost in every tissue of the body. The fact that the capillaries provide a total surface area of the 1000 square miles for exchange between blood and tissue fluid. The average diameter of capillary is 6 to 8 millimeter, as the diameter of erythrocyte is about 7 millimeter. Only one erythrocyte passes at a time. Thus, RBCs pass through a capillary in a single file. Unlike the vessel of the arterial that carry blood from capillaries to the heart, the large veins are formed by the union of smaller veins, like the tributaries of a river. The, they have larger lumen as compared to arteries and less amount of muscular and elastic tissue in the walls. Their lumen is often provided that bulbs which prevent the reflux of the blood and thus maintain the unidirectional flow of the blood even against gravity. Difference between the capillaries and sinusoid. Capillaries lumen are smaller 5 to 8 millimeter, sinusoid larger 30 to 40 millimeter. Capillaries গুলো ছোট ছোট, wall regular, এটা irregular, made up of the endothelial cells, হচ্ছে capillary wall made up of the endothelial cells and may contain phagocytic cell, continuous or fenestrated with small pores close by diaphragms, are fenestrated with large pores and may be incomplete. তারপর হচ্ছে ক্যাপিলারিস লোকেশন ইন সার্কুলেটরি সিস্টেম, কানেক্ট আর্টারিস অ্যান্ড ভেইনস হচ্ছে ক্যাপিলারিস, আর কানেক্টস আর্টারিস উইথ দি ভেনিউলস অর ভেনিউলস উইথ দি ভেনিউলস, এটা হচ্ছে সাইনোসয়েড. A large veins have dead space around them for their dilatation during increased venous return. General structure. General structure feature of the veins are smaller to those of arteries. Their wall is also made up of three layers that are ill-defined. The tunica adventitia is the thickest and best development layer, contains of collagen, elastic muscle fibers. The tunica media is poorly developed. The proper internal elastic lamina in tunica initia is absent. Difference between arteries and veins are enumerated in table 0.4. Microscopic structure of a medium-sized vein, cross-section showing the different wall layers and the lumen, magnified view of the wall layers. Differs between the arteries and veins. Arteries thicken wall, veins thin walled. Arteries more muscular, veins less muscular. Arteries more elastic, veins less elastic. Arteries smaller lumen always remain patent, larger lumen may be collapsed. Arteries tunica media thicker than the tunica adventitia. Veins tunica media thinner than the tunica adventitia. Arteries no valve in the lumen, veins valves mostly present in the lumen. Thickest coat is arteries in tunica media, whereas the thickest course in vein is tunica adventitia. Classification. The veins are classified into following three types: large, medium sized, small, also called venules. Large veins. All three layers of wall, tunica initia, tunica media, tunica adventitia, are wall differentiate. The tunica adventitia is always thicker than the tunica media. The wall of the large veins have some elastic tissue which resist the pressure of the right arterial systole. Example: inferior vena cava and superior vena cava. Medium-sized veins. These veins also have three layers in the wall, but it becomes gradually different to distinguish the three layers are decreasing size of medium-sized veins. Example: sphenic vein, testicular veins, etc. A small vein or venules. These veins are two types. Post-capillary venules. They are most veins and receive blood from capillaries. Their wall is made up of the endometrium. These veins have the special permeability diffu- diffusion of fluid and white blood cell into the surrounding tissue and absorption of intercellular fluid from the tissue into venules, muscular venules. They are so called because of the presence of one or two layers of the muscle, smooth muscle cell outside the endothelium. The veins are capillate. Envelope veins are capacitance vessels because they return varying quantities of venous blood towards the heart and have the capacity to distend or collapse. Blood supply. The larger veins, like arteries, are also supplied by the nutrient vessel called the vasa vasorum. But in the veins, they penetrate up to the tunica intima. Nerve supply. It is the same as arteries, but nerve fibers innervating the veins are fewer in number than the arteries. Pattern or distribution of arteries and veins. Venous patterns are far more variable than the arterial patterns. Large veins are usually single. Medium-sized veins are usually double, lying on either side of the medium-sized artery. Deep veins distal to the elbow and knee, hence they are called the vena comitans. These veins are united to each other by the short channels which form a network around the artery. In several regions, the venous patterns are quite differentiated than those arterial patterns. Vice versa in brain, liver, and lungs. Venous valves. Inner lining of the most medium and small side veins are thrown at intervals into delicate semilunar folds called the cusps. With the wall of the vein, each cups forms a bulging pocket or sinus. The cups are arranged in pairs facing each other to form valves. The valves open only on the direction towards the heart. And B. Venous valves are bicuspid and consist of two valves. The valves present near the termination of the internal jugular subclavian and femoral veins prevent the venous blood form being the forced back into head, neck, and limbs during increased intrathoracic pressure, during deep interspinous, and during increased intra-abdominal pressure during defecation. And B. The valves are most numerous the veins and limbs, and they are commonly placed just before the mouth of tributary. Opening and closing of venous valve. The valve opens by forward pressure towards the heart. The valve closes by backward pressure. Venous valves: internal jugular vein, subclavian vein, heart, femoral vein. Venous valve near the heart. Muscle fibers in venous valve tend to arranged in a loop near the point of drainage of a tributary to act as slush gate. Veins which don't have valves in their lumen are as follows: superior vena cava, inferior vena cava, hepatic veins, renal veins, uterine veins, ovarian veins, facial veins, pulmonary veins, umbilical veins, emissary veins, portal veins, veins less than 2 mm in diameter. Veins which don't have muscular tissue in the wall are as follows: dural venous sinus, pile veins, retinal veins, veins of erectile tissue of penis, and veins of spongy bone. Clinical correlation. Sites of venipuncture. These superficial veins are commonly used for obtaining blood samples and giving intravenous injection or transfusion or infusion. The common site of venipuncture are the cubital fossa in medial cubital cephalic and basilic veins. Dorsal aspect of the hand in the dorsal venous arch in front of the ankle joint into the great saphenous veins. Factors helping venous flow. Although the venous pressure is low, 2 mm mercury, than the arterial pressure, 100 mm mercury, the venous blood is pumped by the following factors: mass action of the skeletal muscle. One-way flow of blood to the heart is ensured by the presence of venous valves. Negative intrathoracic pressure created during the inspiration sucks the blood from the great veins into the thorax. Pulsation of the arteries. And the effect of the massaging action of the skeletal muscle on the venous blood flow is often distributed as a skeletal muscle pump. The varicose veins. The accumulation of blood in the veins of large legs over a long period of time, as many occur in people whose profession requires standing still all the day, can cause the veins of stretch to the point where the venous valves are no longer efficient. Consequently, due to the black flow of the blood in superficial veins become dilated and tortuous, a condition called the varicosity of veins. The great saphenous veins of lower limbs is most commonly affected. Anastomosis. Anastomosis is the communication between the blood vessel forming the collateral channels. Arterial anastomosis. The arteries don't away always arteries don't always end in the capillaries, rather than their branches join uniting with the branches of other arteries forming the anastomosis. Anastomosis provides the collateral channels for the circulation when one of these arteries is blocked. Different types of anastomosis. Anastomosis two types. Actual anastomosis it occur in the following ways: end to end anastomosis, when arteries joined end to end, labial arteries, facial arteries, arterial arch of the palm and sole. Convergent convergent anastomosis, when two arteries coverage the join each other to form a larger artery. Two vertebral arteries unite to form a large basilar artery. Potential anastomosis. The potential anastomosis take place between the terminal arteries in such type of anastomosis. Collateral circulation cannot take place if one of the arteries is suddenly blocked. However, if sufficient time is given, the arteries can dilate and establish collateral circulation. And coronary arteries. For details, see given below. And arteries. These are the arteries whose branches don't anastomosis with branches of other adjacent arteries. The central arteries of retina. Central artery of retina. Arteries of spine, liver, kidney, metaphysis of long bones, central branches of the cerebral arteries. এগুলো খুব ইম্পর্টেন্ট। অ্যান্ড arteries কোনটা? retinal arteries, central arteries of the spine, liver, kidney, metaphyseal long bones, central artery branch of the cerebral arteries. If these arteries are blocked, they are supplied suffers from ischemia that may lead to cell necrosis. Functional end arteries are not the actual end arteries. Key. Functional end arteries are not the actual end arteries because their anastomosis at the level of the arterioles, potential anastomosis, but it may be if they are blocked, the tissue supplied become ischemic. Coronary arteries and cortical branches of the cerebral arteries. Arteriovenous anastomosis. The direct connection between the arteries and veins without the innervation of the capillaries are termed as the arteriovenous anastomosis or shunts. The terminal artery or each side of the branch join the valve. The arteriovenous shunts have thick muscular wall and are abundantly supplied with the vasomotor sympathetic nerves and thereby may act as the sphincter site. Arteriovenous anastomosis are found at the following site: skin of nose, lips and external ear, mucous membrane of alimentary canal and nose, erectile tissue of sex organs, thyroid gland and tongue. Function. Arteriovenous anastomosis permit direct transfer of the blood from arterioles or venous channels bypassing the capillary bed when the sphincter are relaxed. Function of the arteriovenous anastomosis include the regulation of the temperature, regulation of the regional blood flow, regulation of the blood pressure. The blood passing through the capillaries, Functioning arteriovenous anastomosis or shunt. Blood not passing through the shunt because the sphincter is closed. Hence, it is passed through capillaries when tissue or organ is active. Blood pressure. Blood passing through the shunt because the sphincter is relaxed. Hence, little or no blood pressure is passed through the capillaries when tissue or organ are at rest. Clinical correlation. An organ like kidney and intestine, the arteriovenous anastomosis open up following the massive hemorrhage during road accident or wear injuries. This allows the blood to bypass the capillary bed of kidney and intestine, thus making blood available to vital organs like heart and brain. For this reason, anuria often occurs after the accident, but once the volume of blood is general circulation improves, the arteriovenous shunt gradually close, allowing the blood to pass through the glomerular capillaries. Consequently, the output of urine improves, which good clinical sign after the accident. Circulation of blood. In adult individual, the blood circulates through an the estimate 60,000 miles of vessels through the body to the provide food oxygen to trillions of living cells in the body. At the same time, it removes the waste product of the metabolism. Types of the blood circulation. Blood circulation is in the body can be categorized into the following three types. Pulmonary circulation. The deoxygenated blood entering the right atrium passes to the right ventricle, which pumps it through the pulmonary trunk and pulmonary arteries of the capillaries of the lungs, where it is oxygenated, then through the pulmonary veins in returns to left atrium. H beta. Blood from left atrium passes to the left ventricle, which pumps through the aorta and the branch of the capillaries of the rest of the body. The capillaries join to form the veins, which become increased larger till finally the superior and inferior vena cava and cardiac veins return the deoxygenated blood to right atrium. The right atrium receives the same amount of deoxygenated blood which was pumped by the left ventricle at the same rate. Students must note the blood appears red when oxygen is high, appear blue when oxygen content is low. Therefore, blood is red in pulmonary veins, left sided the heart and systemic arteries, where the blood is blue in systemic veins, right side of the heart and pulmonary arteries. This structure therefore should be colored red and blue according to the anatomical illustrations. এরপর হচ্ছে portal circulation. Portal circulation, it is the fact of part of the systemic circulation. It begins with the capillaries and ends of the capillaries. Blood pressure through two sets of the capillaries before during the into the systemic veins. Portal vessels at the vessels which connect the two sets of the capillaries at their end. The vessel draining the first capillary network is known as portal vessel. Portal vessel, which is important, which branch like an artery to form the second set of capillaries or sinusoid. Such type of circulation is seen in liver, hepatic portal circulation, hepatophysis cerebri, hypothalamic hypophyseal portal circulation, and kidney renal portal circulation. Hepatic portal circulation, the venous blood passes from capillary bed, GIT, spleen, and pancreas through the portal vein to the liver. In the liver, it passes through a secondary capillary bed in the hepatic sinusoid before entering the general circulation via the inferior vena cava. In this way, blood with high concentration of the nutrients absorbed from the stomach and the intestine goes to the liver first, where the contain the modification take place before it supplied to the other parts of the body. Hepatic portal system is essentially concerned with the transport of absorbed nutrient from food to the liver and their subsequent metabolism. Hypothalamo-lipophyseal portal circulation. The blood passes from capillary network in the hypothalamus through the portal vessel into the capillary network in the anterior pituitary vein and veins arising from the capillary network in the anterior pituitary then merges with the general circulation. The neurohormone produced and secreted by the hypothalamus and capillary network within the hypothalamus to reach the anterior pulmonary, where they act on the cell of the anterior pituitary to the either increase or decrease their secretion. The hormones secreted by the anterior pituitary enter the capillary network within the anterior pituitary and they carried by the general circulation to the target tissue. Through the hypothalamic hypophyseal portal system, the hypothalamus regulates the activities of the endophyseal anterior pituitary by means of the neurochromes and releasing or emitting hormones. Renal portal circulation. The afferent arterioles supply blood to the glomerular capillaries of the renal corpuscles. Efferent arterioles portal veins arises from the glomerular capillaries and carry the blood away from glomerulus. The efferent arteriole give rise to plexus of capillaries around the proximal and distal convoluted tubules. The peritubular capillaries drain into the general circulation through the interlobular vein. Thus, the renal portal system connects the glomerular capillaries with the peritubular capillaries. This mechanism helps reabsorption of the some essential constituent of the glomerular filtrate back of the blood. Fetal circulation. and fetal circulation পড়তে হবে fetal circulation different from the circulation in adult this because of following reason the collapse of the fetal lung are neuro non-functional portal circulation is the little significant the oxygenated blood occur in the placenta তিনটা জিনিসের জন্য collapse of the কি ductus venous shunts the blood from the umbilical vein to the inferior vena cava bypassing the liver. Foramina ovale shunts of the blood from the right atrium to the left atrium bypassing the pulmonary circulation. Ductus arteriosus shunts of the blood from the left pulmonary artery to the aorta bypassing the pulmonary circulation. Details are as follows. Fetal bus chase with nutritive material and oxygen levels to the placenta to enter the left umbilical vein, which traverse the umbilical cord to end in the remaining branch of portal vein. Only some amount of blood from blood portal vein follows through the liver. However, most of the blood bypass the liver via the ductus venous to the inferior vena cava, which opens into the right atrium. Most of the blood through the right atrium by the inferior vena cava is shunted through the foramina ovale, opening in the internal septum into the left atrium. Thereby, the short circulating pulmonary circuit. It then passes through the left ventricle into the ascending aorta and the aortic arch, and by the branches it is distributed to the heart, head and neck and upper limbs. The blood from head and neck, the upper limbs returns to the right atrium to the superior vena cava. From the right atrium it passes to the right ventricle and then into the pulmonary trunk. From here most of the blood is short circulate to the aorta by ductus arteriosus that connects the left pulmonary artery to the aortic arch just behind on origin the left subclavian artery. Then the blood is distributed by the aorta and common iliac arteries to the abdomen, lower limbs and placenta. The umbilical arteries on each side pass by the sides of the bladder and up the anterior abdominal to the umbilicus and then through the umbilical cord to the placenta. Fetal circulation is summarized in the whole flowchart 10.1. The remains formed by the closer and fetal circulatory structure after birth following the start of the neonatal circulation are present. And B since the function of the placenta are concerned with nutrition, excretion, respiration in fetus, the portal, renal, pulmonary circulation are the little significance. Placental circulation is paramount. Placenta is the organ of oxygenation in fetus. Remnants the result of the closure of the fetal circulatory structure. Fetal structure adult remain বুঝছো কিছু fetal structure adult থাকে সেগুলো remain থাকে ductus venous ligamentum venosum foramina ovalis ductus arteriosus ligamentum arteriosum left umbilical vein ligamentum teres hepatis right and left umbilical arteries medial umbilical ligaments 10 পাতা পড়ে ফেলছি
Golden facts to remember. First organ in the body to start functioning, heart. Large artery in the body, aorta. Largest vein in the body, inferior vena cava, IVC. Longest vein in the body, great saphenous vein. Great saphenous vein, longest vein in the body. Largest portal vessel in the body, portal vein. Most commonly used artery for measuring blood pressure, bronchial artery. Most commonly felt arterial pulse in the body, radial pulse. Most reliable pulse in the body, carotid pulse. Best example of an end artery in the body, central artery of retina of the eye. Best example of functioning end arteries, coronary arteries. Most commonly used vein for intravenous injection, median cubital vein in the cubital fossa. Total length of all capillaries joined end to end 60,000 miles. Total amount of blood in vascular system 5 liter. Most abundant leukocytes in peripheral circulation, neutrophils. All the cells of the blood are nucleated except mature red blood cells, RBCS. All the arteries in the body contain oxygenated blood except pulmonary arteries in adults and umbilical arteries in fetus, which contain deoxygenated blood. All veins in the body contain deoxygenated blood except pulmonary veins in adults and umbilical veins in fetus, which contain oxygenated blood. All the arteries in the body are filled during cytosol except coronary arteries, which are filled during diastole. Vessels are responsible for maximum peripheral vascular resistance arterioles. All the following are examples of elastic arteries except radial artery. All of the following are examples of distributing vessels except common carotid artery. Arterioles are examples of resistance vessels. Fenestrated capillaries are found in all of the following sites except lung. Veins are an example of capacitance vessels. All of the following are examples of end arteries except facial artery. All of the following are veins without valves in their lumen except sphenous veins. All of the following sphenous veins. All of the following veins do not have muscular tissue in their wall except venules. Which of the following arteries are examples of functional end arteries? It is B. Coronary arteries. Arteriovenous anastomos are found at all of the following sites except liver. All of the following are features of veins except thin tunica adventitia. Stimulation of sympathetic fibers cause vasodilation of all of the following arteries except arteries of GIT. Nerve supply of arteries is mostly derived from non-myelinated sympathetic nerve fibers. All of the following are examples of total circulation except pulmonary circulation. Which of the following arteries are filled mainly during diastole? Coronary arteries. Chapter 11 Lymphatic System Learning Objectives. After studying this chapter, the student should be able to define lymphatic system and discuss its functions, elucidate the components of lymphatic system, outline the structure and functions of lymph nodes, Dis- describe the location, structure, and functions of spleen. Describe the location and function of thymus gland. Describe the location and function of mucosa associated lymphocyte tissue MLT. Discuss the role of the different types of lymphocytes in providing cell mediated immunity. Explain the process of antibody mediated immunity. Correctively solve the review questions given at the end of the chapter. Introduction. The lymphatic system of an extensive network of externally valuable lymph vessels and lymph nodes through which lymph circulates. The lymphatic system defends the body from bacteria, virus, and other harmful agents. The lymphatic system is essentially a drainage system which is accessory to the venous system. Most of the tissue fluid formed at the arterial ends of the capillaries is absorbed back into the body by the venous ends of capillaries. The remaining tissue fluid is by, absorbed by lymph capillaries, which begin blindly in the tissue space and is sent back to the blood. In addition to lymph vessels and lymph nodes, the lymphatic system consists of large amount of lymphatic tissue present in the body in different forms. The functions of the lymphatic system are as follows: drains excess tissue fluid to the venous system. For example, tissue fluid which could not be drained by the venous system. Absorbs fat from the intestine and transports it to the blood. Helps to provide immunological defense against these disease causing agents. Components of the lymphatic system: the lymphatic system consists of lymph capillaries, lymph vessels, lymphoid organs, lymph nodes, spleen, thymus, epithelial lymphoid system, bone marrow, lymph. The tissue fluid that enters the lymph capillaries is called lymph. Generally, it is clear, watery fluid similar to composition of plasma, with the important exception of plasma proteins. However, the plasma from small intestine is milky white, called chyle, because it contains large leaflets of fat absorbed from intestine. The lymph transports the plasma protein that seep, seep, seep out of the capillary beds back to the blood system. It also carries away large particles, for example, bacteria and cell debris, which is then filtered out and destroyed by the lymph nodes. Thus, the lymph contains lymphocytes, macromolecules of protein, fat, droplets, and particulate matter such as dust particles, carbon particles. Palpable lymph nodes: clavicle, axillary, inguinal, jugular trunk, right lymphatic trunk, subclavian trunk, brachomediastinal trunk, thoracic trunk, mediastinal lymph nodes, arteritic and mesenteric nodes, supratrochlear, epitrochlear lymph nodes, sister chyli, lumbar lymph nodes, iliac lymph nodes, popliteal lymph nodes. Figure 11.1. A schematic diagram of a human being showing major location of lymph nodes, thoracic duct, right lymphatic duct, and other lymph vessels. Figure 11.2. A schematic diagram showing the relationship between lymphatic system and cardiovascular system. Bacteria, etc., to an extent that constitute of lymph is similar to the plasma. Clinical correlation: lymphoedema. About 30 liters of fluid passes from the arterial ends of capillaries into the intercircular space every day. Out of this, about 27 liters of fluid consist of micromolecules are absorbed back by venous ends of capillaries. The remaining 3 liters of fluid consisting of macromolecules of protein, fat droplets, and particulate matter such as bacteria is absorbed by lymph capillaries. For this reason, the lymphatic system is regarded as drainage system of the coarse type, and venous system as drainage system of the fine type. If extra 3 liters of fluid is not drained by the lymph system, the accumulation of this fluid in the tissue will cause edema, swelling. Lymph capillaries. The lymph capillaries are microscopic, blind-ended lymph vessels which begin in the intracellular space. They form vast network in intracellular space from most of the tissue of the body. The walls of the lymph capillaries, like these of blood capillaries, are made of single layer of endothelial cells, but they are more permeable to tissue fluid and contain large molecules such as proteins, particulate matter, and colloidal matter. Note 12. Lymph capillaries are most numerous in skin, gland, mucous, and serous membrane. Lymph capillaries within the villi of small intestine are called lacteals. They absorb fat and transport into the blood. The lymph capillaries differ from blood capillaries in following respects: being blindly in intracellular space, have a bigger lumen which is less regular, are permeable to bigger molecules, hence absorb tissue fluid containing particulate matter and colloid matter. The site where lymph capillaries are absent are epidermis, hair, nails, cornea, articular cartilage, brain and spinal cord, bone marrow, splenic pulp. Lymph vessels. The lymph capillaries unite to form lymphatic vessels. They are thin-walled vessels 0.5 to 1 millimeter in diameter and have beaded appearance. Lymph capillaries. The lymph capillaries are microscopic, blind-ended lymph vessels which begin in the intracellular space. They form a vast network in intracellular space of most of the tissue of the body. The walls of the lymph capillaries. In fact, once the vessels are formed, they converge on a lymph node. The lymph passes through this lymph node and leaves it through another lymph vessel, which enters another lymph node. The lymph leaves this node through yet another vessel. This process is repeated. The smaller lymph vessels merge into form progressive large lymph vessels called lymph ducts, which empty into subclavian vein. Figure 11.3, a schematic diagram showing origin of lymph vessels from lymph capillaries present in the tissue space and drain into lymph nodes. The lymph trunks open into the vein. Note the bladed appearance of lymph vessels due to the presence of valves in their lumen. Clinical correlation: lymphangitis. Sometimes lymph vessels become inflamed, leading to lymphangitis. This often results in visible clinical correlation: lymphangitis. Sometimes lymph vessels become inflamed, leading to lymphangitis. This often results in visible red stakes in skin extending from the site of infection to the group of lymph nodes where the lymph vessels drain. For example, in infection of red scates on the hand may be seen spreading from the hand to axilla. Elephantitis. If lymph vessels draining the lower limb are blocked by long, slender worms of filaria, the accumulation of fluid in the interstitial space and lymph vessels may cause permanent swelling and enlargement of lower limb, resembling an elephant's leg, producing a clinical condition called elephantitis. There are two types of principal lymph ducts: thoracic duct, right lymphatic duct. Thoracic duct. The thoracic duct is the largest lymphatic duct, about 45 centimeters long in the body. This begins as the large sac-like dilated lymph channel called cisterna chyli, lying in front of the bodies of L1 and L2 vertebrae and ends in the angle between the left internal jugular and vein and left subclavian vein. The drain limbs from the whole of the body except right upper quadrant, from which the lymph is drained by right lymphatic duct. The thoracic duct remains the lymph from lower extremities, abdomen, left thoracic region, left upper limb, left side of head and neck. Right lymphatic duct. The right lymphatic duct is a dilated lymph vessel about 1 centimeter long. It lies on the root of neck on the right side and it is formed by the union of three vessels: right jugular trunk, left subclavian trunk, right bronchomeristerial trunk, and it ends by the opening in the angle between right bronchiocephalic vein and right subclavian vein. The right lymphatic duct drains the lymph from right upper limb, right thoracic region, right side of the head and neck. Structure of lymphatic duct. Like the walls of the veins, the walls of lymphatic duct have some three layers. For example, tunica adventitia, tunica media, and tunica intima. Figure for 11.4. Lymphatic drainage of the body. Upper right quadrant of the body drains into the right lymphatic duct. The remaining body drains into the thoracic duct. The lumen of lymphatic duct containing valves which are more numerous and closely packed with veins. The lumen of vessels proximal to the valve is expanded into a sinus. The valves are so closely packed that lymph vessels, when filled with lymph, has a beaded appearance. Figure 11.4. Lymphatic drainage of the body. Upper right quadrant of the body drains into the right lymphatic duct. The remaining body drains into the thoracic duct. The lumen of lymphatic duct contains valves which are more numerous and closely packed than veins. The lumen of vessels proximal to the valve is expanded into the sinus. The valves are so closely placed that lymph vessels, when filled with lymph, has a beaded appearance. Superficial and deep lymph vessels. According to their location, the lymph vessels are divided into two types: superficial lymph vessels, which are found on the superficial fascia deep to skin. They join deep lymph vessels. Deep lymph vessels, which are found deep to deep fascia, are accompany the blood vessels. Note: while lymph vessels are supplied by vasa vasorum and are accompanied by a plexus of fine blood vessels, lymph vessels have a great number of regeneration after their damage. The valves in lymph vessels permit the flow of lymph only in one direction, for example the periphery of the center, and prevent the backflow. Drainage of the lymph. The factors responsible for the drainage of the lymph through the lymph vessels are lymphatic ducts are as follows: contraction of a smooth muscle in the wall of the lymph vessels, pulsation of arteries lying near the lymph vessels, messaging action from contraction of surrounding muscles, filtration pressure in tissue spaces generated by filtration of fluid from blood capillaries, respiratory movements, negative pressure in bronchiocephalic veins. Note: well, there is no pump like the heart involved in the onward movement of the limb, but the muscle tissue in the wall of the large lymph vessels has a intrinsic ability to contract rhythmically, so it's called lymphatic pump. Lymphoid organs. The lymphoid organs are made of lymphatic tissue. The Lymphatic tissue is a specialized connective tissue and consists of a framework of reticular fibers and reticular cells. Lymphocytes mainly are related to plasma cells and macrophages.
Immunity is the defense mechanism of the body. The ability of the body to resist damage from foreign substances such as the microorganism and harmful toxins released by them. The defense mechanism of the body includes phagocytosis, which is non-specific engulfing process, and immune response, which is a specific reaction to microorganisms and antigens. The cell type involved in immune response is lymphocytes. The lymphocytes are smaller than the monocyte and have large nuclei. The lymphocytes circulate in blood, are present in large numbers in lymphatic organs and tissue. They develop from pluripotent stem cell in red bone marrow and then travel in blood to lymphoid tissue elsewhere in the body where they are activated, becoming immunocompetent, which means they are able to respond to antigen, foreign material, bacteria, virus, etc. Although all lymphocytes arise from common stem cell in bone marrow, but when they are activated in lymphoid tissue, two distinct types of lymphocytes are produced. Vice versa, T lymphocyte and B lymphocytes. The lymphocytes are so named because they mature and are proceed in thymus. The B lymphocyte acquired their name from the bursa of the fabaceous cloacal diverticulum in birds, for it was in chickens that the bursa of the fabaceous was the first found to the source of the humoral antibodies. The T lymphocyte are processed in thymus and provide cell-mediated immunity, where the B lymphocytes are processed in bone marrow and provide the antibody-mediated humoral immunity. তারপরে cell mediated immunity. Figure 11:10. When antigen comes in contact with T lymphocyte, it stimulates the division and the proliferation of the T lymphocytes.
The cell mediated immunity, antigen T lymphocytes, cytotoxin T lymphocytes, helper T lymphocytes, memory T lymphocytes bind to antigen and destroy it, release cytokines to support cytotoxin T lymphocytes, long lived and provide immunity to the antigen. Figure 11.1. Proliferation of lymphocytes in cell mediated immunity, leading to production of three main types of specialized T lymphocytes: cytotoxin T lymphocyte, helper T lymphocyte, memory T lymphocyte. All these cells tackle the same antigen in different ways. Figure 11.1. For example, the cytotoxin T lymphocyte bind to antigen and destroy it. The helper T lymphocyte release cytokines to support cytotoxin T lymphocytes. The memory T lymphocytes are long-lived and provide immunity to the antigen. Note well, one of the primary causes of acquired immunodeficiency syndrome (AIDS) is the killing of helper T lymphocytes by human immunodeficiency virus. Antigen B lymphocytes, plasma cell, memory B lymphocytes. Figure 11.1. Proliferation of B lymphocytes in antibody mediated humoral immunity. Antibody mediated humoral immunity. The B lymphocytes, unlike T lymphocytes, which are free to circulate around the body, are fixed with lymphoid tissue. When B lymphocytes come in contact with an antigen, they enlarge and begin to divide. It produces two functionally distinct types of cells: plasma cells, memory B lymphocytes. The plasma cells produce and release antibodies, for example immunoglobulins, immunoglobulin G, A, M, E, and D that bind into antigen and destroy it. The memory B lymphocytes are long lived and provide immunity to the antigen. Bone marrow. The bone marrow is soft pulp vascular tissue. It consists of a delicate network of reticular tissue, stroma, and cluster of hematopoietic cells. For details, see Chapter 6, page 20, page 73. Golden facts to remember. Total number of lymphocyte nodes in body is about 450. Body region having highest number of lymph nodes in the body, abdomen and pelvis. Largest lymphoid organ in the body, spleen. Only lymphoid organ in the body which has both afferent and efferent lymph vessels, lymph node. All the lymphoid organs in the body possess lymphatic nodules, follicles, except thymus. In all the lymphoid organs of the body, supporting framework is made out of reticular cells except thymus, where it is made out of epitheliocytes, also called epithelial reticular cells. Only lymphoid organ in the body which is fully developed at birth, thymus. Largest lymphatic channel in the body, thoracic duct. Most common route for spread of cancer, lymph vessels. All lymphocytes arise from common stem cell in bone marrow except during embryo, embryonic life when they arise from yolk sac, liver and spleen. Most abundant cell type present in the lymphatic organs, lymphocytes. Large lymphatic sac in the body, cisterna chyli. Most abundant immunoglobulin in the body, immunoglobulin G. All are true statements regarding lymphatic system except A. Return all the tissue fluid to the venous system. Thoracic duct drains lymph from all the following regions except right side of the head and neck. All the lymphoid organs have lymphoid nodes except thymus. Lymphoid organs have both afferent and efferent lymph vessels is lymph node. All are true regarding thymus except it filters blood to remove blood-borne antigens. All the following factors help in lymphatic drainage except positive pressure to bronchiocephalic veins. All the following sites are devoid of lymph capillaries except dermis. Lymph vessels are present in all except brain. Which of the following is primary lymphoid tissue? Thymus. Epithelial reticulum is a feature of thymus. Chapter 12, Nervous System. Learning Objectives. After studying this chapter, the student should be able to
Studying the chapter, the student should able to define the nervous system and list its function, outline the subdivision of the nervous system, outline the main morphological types of neurons, and describe the structure of a typical neuron. Describe the nervous types of the neuroglia and discuss their function. Describe the structure and function of a synapse and elucidate the nervous type of synapse. Classify the nervous and discuss the relaxed action. Describe the typical spinal nerve and list the spinal nerves that from nerve plexus. Present a brief account of dermatome. A dermatome. Identify two divisions of the autonomic nervous system. Compare and contrast the effects of the synaptic and parasympathetic stimulation. Explain how referred pain occurred. Enumerate the neurotransmitters liberated by the pre and post ganglionic fibers of the parasympathetic and sympathetic nervous system. Correctly solve the review question began at the end of the chapter. Introduction. The nervous system integrates and controls the activities of all other systems of the body. Hence, it is also termed as the master system of the body. তার নার্ভাস সিস্টেম কি মাস্টার সিস্টেম জিজ্ঞেস করো হোয়াট ইজ মাস্টার সিস্টেম নার্ভাস system is the master system. The function of the nervous system include the reception of stimuli from within the outside the body, integration of the sensory information, initiation and execution of the motor responses, assimilation of the experience, and an essential request to memory, learning, and intelligence. Due to the to Due to this function, an individual is able to maintain the internal environment of the body and react to the change in the external environment. All activities of nervous system, whether simple or complex, involve three neural factors or elements: reception, integration, response. In human beings, the integrative elements shows the maximum degree of development, and they are the most intellectual animals in the animal kingdom. Subdivision of the nervous system, anatomical subdivision, central nervous system, peripheral nervous system. Central nervous system includes the brain and spinal cord. Peripheral nervous system, it include all neural structure outside this central nervous system. Example, the peripheral nerves, 12 pair of the central cranial nerves, 31 pairs of spinal nerves. 12 pairs cranial nerves, 31 pairs of spinal nerves. Ganglia, autonomic and sensory. Autonomic nervous system, sympathetic and parasympathetic nervous systems. Functional subdivision, afferent or sensory division, it brings information to central nervous system. Efferent, motor division, it gives appropriate motor command to muscle and glands. The efferent division is further divided into components: somatic nervous system, autonomic nervous system. It innervates somatic structure like skeletal muscle and responsible for voluntary motor activities. Autonomic nervous system, it innervates visceral structure like cardiac muscle, smooth muscle, and glands. The activities of viscera are mostly involuntary, not under voluntary control. Anatomical subdivision of the nervous system. Anatomical subdivision of the nervous system. Sensory efferent, motor afferent. Sensory receptor within joint and skeletal muscle, somatic, autonomic ganglia, sensory nervous system, sensory receptor with the visceral organ, cardiac muscle, central nervous system, cardiac muscle, smooth muscle, and glands. Functional subdivision of the nervous system. Cell body. The cell body consists of a mass of cytoplasm surrounding by a plasma membrane. It contains a large vesicular nucleus with prominent nucleus. The two main characteristic features of the cytoplasm of the neuron are present of the basophilic nasal substance, nasal bodies, neurofibrils. The nasal substance is composed of the large aggregation of the rough endoplasmic reticulum, which contain ribonucleic acid concerned with the protein synthesis. Neurotransmitters, neurofibrils are filamentous strands or proteins. And B, these are no centrioles and centrosomes in the nervous cell. There are no centrioles and centrosome in the nervous cell body, which indicates that the highly specialized nervous cell has lost its power of division. Consequently, once the nerve cell is destroyed, it is replaced by neuroglia. Process. The process of two types. Neural short process called the dendron tree, a single long process called the axon. Dendrites brings impulses towards the cell body, hence they often branch profusely to increase the reception area of neuron. The axon is a single long process. It does not branch except at the termination of to some teratodendria, which process terminal boutons or presympathetic knobs. Atypical peripheral neurons. Dendrites, neurofibrils, axon hillock. Body of the well developed nucleus large and and Eurochromic, nasal bodies, myelin sheath, Schwann cells. A typical collection of the nerve cell bodies within central nervous system is called the nucleus, whereas the collection of nerve cell bodies outside the central nervous system is called ganglion. Axon is termed as nerve fiber. Bundles of the nerve fibers within the central nervous system from the tracts, while outside the central nervous system they from the peripheral nerves. Gray matter consists of mainly nerve cell bodies and dendrites, while white matter consists of mainly nerve fibers. Classification of neurons according to polarity. Pseudo-unipolar neurons. They appear to have only one process, which soon divides into a central branch that function as axon and a peripheral branch that serve as a dendrite. Most sensory neurons of the nervous system are pseudo-unipolar type. Pseudo-unipolar neurons are so called because originally two processes emerged at the same pole, but during the course of development, two processes fuse to form a single process that bifurcates at the little distance from the cell body. Sites of location: posterior root ganglia of the spinal nerves, sensory ganglia of the cranial nerves. একটা হচ্ছে pseudounipolar, একটা bipolar neurons. They have two processes, one on each pole. One process acts as dendrite and other process acts as axon. Site of location: retina of the eye, olfactory epithelium, vestibular ganglia. There are main type of neurons based on three: morphology, pseudounipolar, bipolar, multipolar. Multipolar neurons. They have several dendrites and only one axon existing from the cell body. They are the most common type of neurons in the nervous system. Site of location: motor neurons forming tracts of brain and spinal cord. Motor neurons of anterior horn cell forming peripheral nerves. Motor neurons of autonomic ganglia. এটা গেল যে তোমার অ্যাকর্ডিং টু সাইট অফ লোকেশন, অ্যাকর্ডিং টু পোলারিটি। এখন হচ্ছে অ্যাকর্ডিং টু দি রিলেটিভ লেন্থ অফ axon and dendrites.
Classification of neurons. According to polarity. Pseudo-unipolar neurons. They appear to have only one process which soon divides into a central branch that functions as axon and a peripheral branch that serves as a dendrite. Most sensory neurons of the nervous system are pseudo-unipolar type. Note well, pseudo-unipolar neurons are so called because originally two processes emerges at the same pole. But during the course of development, two processes fuse to form a single process that bifurcates at a little distance from the cell body. Sites of location: posterior dorsal root ganglia of spinal nerves, sensory ganglia of central nerves. Bipolar neurons. They have two processes on one each pole. On process acts the dendrite and the other process acts as an axon. Sites of location: retina of the eye, olfactory epithelium, vestibulocochlear ganglia. 3. Multipolar neuron. They have several dendrites and only one axon extending from the cell body. They are the most common types of neurons in the nervous system. Sites of location: motor neurons forming tracts of brain and spinal cord. Motor neurons of anterior horn cell forming peripheral nerves. Motor neurons of automatic ganglia. B. According to relevant length of axon and dendrites. Golgi type eye neurons. These neurons have long axons which may be up to 1 millimeter long. For example, pyramidal cell of cerebral cortex, anterior horn cell of a spinal cord, and Purkinje cells in cerebellum. Golgi type 2 neurons. The axon of these neurons are short and morphologically similar to dendrites, giving these neurons a star-shaped appearance. According to the shape of the cell body: pyramidal cell. The cell body is cone pyramidal shaped and dendrite arises from the angle of the cone. For example, pyramidal cells of motor cortex of cerebral hemisphere. Fuse fusiform cells. The cell bodies in spindle shaped and process emerge at the both ends. For example, fusiform cells of motor cortex and cerebral hemisphere. Pyriform cells. The cell body is flash shaped. The thick dendrite arises from the upper and divides repeatedly, whereas the axon arises from the base. For example, Purkinje cells of cerebellum. Other types: stellate cells. Dendrites extend to all directions from the cell body. For example, stellate cells of cerebral cortex and sympathetic ganglia. Glomerular cells. Dendrites at their tip are highly collided granule cells of cerebellar cortex. Amacrine cells. They lack an obvious axon, have a single process permit conduction in their direction. For example, amacrine cells of retina of the eye ganglion. These are collections of cell bodies of neurons outside the central nervous system. They can be classified into two types: cerebral ganglia. They have connected with sensory efferent nerve fibers of the cranial and spinal nerves, hence they are called sensory ganglia. Autonomic ganglia. They are connected with autonomic outflow and consist of cell bodies of multipolar motor neurons. Hence, they are called motor ganglia. They are relay stations of preganglionic, sympathetic, and parasympathetic fibers. The sympathetic ganglion lie away from the viscera they supply, whereas parasympathetic ganglia lie near the viscera they supply. Neuroglia. They provide structural and functional support to axons. The neuroglia play no important role in propagation of impulses or process of perceived information. The neuroglia are far more numerous, about 5 to 10 times more than neurons, and account for more than half of the brain's weight. The structure of neuroglia. Neuroglia. They provide structural and functional support to axons. The neuroglia play no important role in propagation of impulses or processing of perceived information. The neuroglia are far more numerous, about 5 to 10 times more than neutrons, and account for more than half of the brain's weight. Structure of neuroglia. Neuroglia are highly branched cells and occupy the space between the neurons and provide a microenvironment suitable for neural activity. Remember that nervous tissue has no intellectual matrix. Classification of neuroglia. Astrocytes. These are the largest and most numerous. The astrocytes are star shaped with many dendrite like process which and possess small swellings called foot process. The foot processes from sleeves around the capillaries. Processes. The foot process from sleeves around the capillaries. The sleeve around the endothelial half of the capillaries form the blood-brain barrier. The astrocytes are of two types: protoplasmic, found in gray matter, and fibrous, found in white matter. Oligodendrocytes. These are smaller than astrocytes and, as the name implies, have fewer processes. Oligodendrocytes from myelin sheath around the fibers of CNS. Ependymal cells. These cells line the ventricles of brain and in the central canal of a spinal cord. Microglia. These are the smallest glia cells. These are phagocytic cells derived from mesoderm. Clinical correlation. Gliosis. The microglia migrate to areas damaged by infection, trauma, or stroke and perform phagocytes. The damaged neurons are replaced by the proliferation of astrocytes, a process called gliosis. Glioblastoma multiforme is the most fatal brain tumor with life expectancy of 2 to 3 months only. It arises from astrocytes.
পোস্ট সিস্টেম না না পেরিফেরাল নার্ভাস সিস্টেম পিএনএস মানে কি
পেরিফেরাল নার্ভাস সিস্টেম
পেরিফেরাল নার্ভাস সিস্টেম তারপরে স্যাটেলাইট বা ক্যাপসুলার সেল দিস সেল সারাউন্ড দি সেল বডিজ অফ দি অটোনমিক অ্যান্ড সেন্সরি গ্যাংলিয়া to which they provide support and nutrition. Swan cell are neurolemocytes. These cells from the myelin sheath around the nerve fibers of the peripheral nervous system. According to their structure, macroglia, they include astrocytes, oligodendrocyte, and the ependymal cells, microglia, already described. Swan cells from the lemma, the swan sheath, around all nerve fibers of the post-nervous system, whether they are myelinated or non-myelinated. The swan cells play an important role in the regeneration of the peripheral nervous fibers. All the neuroglia develop from the neural crest except microglia, which develops from the mesoderm bone marrow. Function of the neuroglia. The function performed by the neuroglia cells are as follows: provide the structural and functional support of the neurons, help to form the blood-brain barrier, phagocytes foreign substance, produce cerebrospinal fluid, central cerebrospinal fluid, form myelin sheath around axons, nerve fibers.
The axons of nerve cell is called nerve fibers. The bundle of axon fibers within the central nervous system are called tracts, whereas the bundle of nerve fibers in peripheral nervous system are called peripheral nerves or simple nerves. The following two types of nerve fibers are found in the nervous system: myelinated nerve fibers, non-myelinated nerve fibers. Myelination of nerve fibers. The fiber of CNS are myelinated by oligodendrocytes while those of PNS by Schwann cells. Myelination of nerve fibers. The myelination of a peripheral nerve occurs in the following way. The Schwann cell arranges in a sequence along the nerve fiber which invaginates them from maxons. Then each Schwann cell rotates many times around the nerve fiber. As a result, mesons become wrapped repeatedly around the axon and cytoplasm is extruded in the Schwann cell body. The myelin sheath consists of many layers of plasma membrane of Schwann cell, which is made out of white lipid protein and provide whitish appearance to the fiber. The outer surface of myelin sheath is encased in a glycoprotein, forming neurolamal sheath. Each Schwann cell myelinates only 1 millimeter of axon, thus leaving a gap in the myelin sheath, whereas the axon is exposed to exterior. These gaps are called the node of Ranvier. The CNS fibers are myelinated by oligodendrocytes, unlike the Schwann cells, which form a myelin sheath around only one axon. Each oligodendrocyte has extensions that form myelin sheath around the several axons. The non-myelinated fibers are also surrounded by the Schwann cells. Several axons, 15 or more, become longitudinally invaginated into the cytoplasm Schwann cell and are scaled by plasma membrane. Each Schwann cell myelin only is 1 millimeter of axon. The non-myelinated fibers are also surrounded by the Schwann cell. Several axons, 15 or more, become longitudinally invaginated into the cytoplasm of Schwann cell and are sealed by plasma membrane. The examples of myelinated fibers are nerve fibers of the somatic nervous system more than 1 micrometer in diameter, all preganglion fibers of autonomic nervous system ANS. The examples of non-myelinated fibers are nerve fibers of somatic nerve system less than 1 micrometer in diameter, all postganglionic fibers of autonomic nervous system, conduction of action potential along an axon. Conducting vessels, for example, large arteries. For details, see arteries. Distributing vessels, for example, small arteries. For details, see arteries. Resistance vessels, for example, arterioles. For details, see arteries. Exchange vessels, for example, capillaries, sinusoid and postcurve vacillary venules. Capacitance or reservoir vessels, for example, large volumes and veins, large venules and veins. These are low pressure, large volume vessels. The high capacity of these vessels is due to the fact that they are thin walled and have the capacity to dilate. Arteries. Characteristics features. The silent features of arteries are as follows. They are thick walled vessels and carry blood from the heart to capillaries. They are often accompanied by veins and nerves. The three of them together form the neurovascular bundle. Their lumen is smaller than that of accompanying vein or veins. They do not have valves in their lumen. They divide repeatedly like a branch of tree and gradually becomes smaller in size. General microscopic structure. The arterial wall is made of three layer coats. Figure 10.1 A and B. From within outwards, these are tunica intima, tunica media, tunica adventitia. Figure 10.7 Microscopic structure of medium sized artery. A. Cross section showing different wall layers and the lumen. B. Magnified view of wall layers. Tunica intima is made for in endothelium consisting of flat tunnels cells and basal lamina. Externally, the endothelium is supported by subordinatal loose connective tissue and fenestered membrane of elastic tissue called internal elastic lamina. Tunica media is the thickest layer and made of alternate layers of circulatory arranged smooth muscle fibers and elastic fibers. The tunica media is limited externally by fenestrated membrane of elastic tissue called external elastic lamina. Tunica adventitia is thin but strongest of all coats. The tunica adventitia is made of longitudinal arranged connective tissue fibers, both elastic and collagen, and connective tissue cell. It merges with the perivisceral sheath. The structure of artery is summarized on table 10.1. Clinical correlation. Arteriosclerosis or hardening of arteries. Note well, an embolus is thrombus that has dislodged from the wall of the vessel and moves to the bloodstream. Both thrombus and embolus can oscillate flow. An embolus lodged in the coronary artery, coronary embolism, is called coronary thrombus in a vessel of lung. It is called pulmonary thrombus in a vessel of brain. It is called cerebral thrombus. Classification. Functionally, arteries are classified into three steps: elastic, conducting arteries, muscular, distributing arteries, arterioles, resistance vessels. Note 12. There is a gradual change in diameter, thickness of the wall, amount of elastic tissues and muscular tissues in the wall from large size elastic arteries to muscular arteries to arterioles. Elastic arteries, conducting vessels, are large arteries arising from the heart and their main branches. For example, aorta, brachiocephalic trunk, common carotid artery, and the subclavian artery. They are called elastic arteries because tunica media of these arteries is predominantly made out of elastic fibers. They are also called conducting vessels as their main function is conduct blood from the heart to the muscular arteries. Muscular arteries. Lymphoid organs. The lymphoid organs are made out of lymphatic tissue. The lymphatic tissue is a specialized connective tissue and consists of a framework of rectangular fibers and reticular cells. Lymphocytes mainly are The lymphatic tissue is a specialized connective tissue and consists of a framework of rectangular fibers and reticular cells. Lymphocytes mainly are related plasma cells and macrophages. A circumscribed concentration of lymphatic tissue are called lymph nodes, which are found both in scattered lymphatic tissue and encapsulated lymphoid organs. The lymphatic nodules may show light stained area in its central called germinal center, which consists large eu- euchromatic my euchromatic mylymphoblasts and plasmoblasts, which produce lymphatic and plasma cells, which contain large euchromatic lymphoblasts and plasmoblasts, which produce lymphocytes and plasma cells. In the lymph nodule, the general center develops only when the nodule is exposed to the antigen. The germinal center are absent in embryonic life and in old age. The germinal center is surrounded by darkly stained zone of densely packed small lymphocytes. The lymphoid organs are classified into the following two types: primary lymphoid organs, which are involved in the production of lymphocytes, for example, bone marrow and thymus; secondary lymphoid organs, which are involved in activation of lymphocytes and initiation of an immune response, for example, lymph nodes, spleen. Note while lymphocytes are capable of identifying foreign antigens at molecular level and responding to them immunologically. Macrophage, Macrophages phagocytes foreign agents such as bacteria, virus, and cancer cells. Lymph nodes. The lymph nodes are oval and bean shaped bodies 0.1 to 2.5 cm long that lie along the course of lymph vessels. The lymph passes through a number of lymph nodules, usually 8 to 10, before reaching the large lymphatic ducts. The size of lymph nodes varies from pinhead to a large bean and are somewhat flattened. The lymph nodes are pink in living body and brownish in cadaver emblemed dead bodies. Note 12. The lymph nodes draining the lymphs from the lungs are black due to retention of inhaled carbon particles, whereas those drained in small intestine are creamy white due to intention of emulsified fat. Lungs are black due to retention of inhaled carbon particles. The lymph nodes tend to occur in cluster groups in specific regions of the body. Some of the body's principal groups of lymph nodes are cervical lymph nodes in the neck, axillary nodes in the upper limb, mediastinal lymph nodes in the thorax, aortic and mesenteric lymph nodes in the abdomen, iliac lymph nodes in pelvis, popliteal and inguinal nodes in the lower limb. The superficial lymph nodes are arranged along the veins and deep along the arteries. The superficial lymph nodes are present in the superficial fossa, deep into skin, whereas deep lymph nodes are located deep to deep fascia. The superficial lymph nodes drain into deep lymph nodes. Note well, there are about 450 lymph nodes in the body of a young individual, out of which 60 to 70 are found in regions of head neck, 10 in the thorax and 25 in the abdomen and pelvis. Structure of lymph nodes. The lymph nodes are oval or reniform and slightly flattened. They present a slight depression on the site called hilum. Many afferent types vessels enter the gland at peripheral, and a single afferent lymphatic vessel leaves the gland through the hilum. The artery enters and vein leaves the gland at the hilum. Each hilum node consists of fibrous capsule and gland substance, parenchyma capsule. The fibrous capsule invades the entire node and is separated from the gland substance by subscapular space and called subscapular sinus. A number of trabecular extended from capsule at variable distances subs- into the substance of the gland. The trabecule are accompanied by paratrabecular space, which are continuous with the subscapular sinus. The afferent lymph vessels pierce the capsule and drain into subscapular sinus. From subscapular sinus, the lymph drains via a series of intraconnected channels, the coccygeal and medullary sinus, into the hilum of the node, from which arises single different lymph vessel. Gland substance. The gland substance is divided into two portions, a outer portion called cortex and an inner portion called medulla. The outer portion of cortex, the superficial cortex, contain a B lymphocytes which from variable number of densely packed lymphoid follicles nodules. Many of these nodules slow, show less dense central region called germinal centers. The lymphoid follicles without germinal centers are called primary nodules, and those with general centers are called secondary nodules. The general centers are the areas of rapid lymphocyte division and occupied by lymphoblast and plasmablast. The peripheral portion of the nodule consists of a small lymphocytes and plasma cells. The inner portion of cortex paracortex consists of lymphocytes, thymic dependent zone. The T lymphocytes do not organize themselves to form lymphoid nodules. The medulla contains network of anastomosing cords of cells called medullary cords. The cells within medullary cords are B lymphocytes, plasma cell, and macrophages. Note well, both cortex and medulla, in addition to lymphocytes, contain reticular cells which along the reticular fiber form the framework of lymph node. Plasma cell B lymphatic mature into plasma cell and are mainly located into the medullary cords. The afferent lymph vessels pierce the capsule and drain into subscapular sinus. From subscapular sinus, the lymph drains via a series of interconnected channels, the cortical and medullary sinus into the hilum of the node, from which arises single efferent lymph vessel, gland substance. The gland substance is divided into two portions: a outer portion called cortex, a inner portion called medulla. Reticular cells, which along with reticular fibers form the framework of lymph node. Plasma cell B lymphocytes mature into plasma called are mainly located into the medullary cords. Macrophages mainly present in the medulla but also common in germinal centers. These cells present the antigen to lymphocytes for immunological response. The parenchyma of both cortex and medulla is traversed by blood vessels and lymph sinuses. Circulation of lymph and blood in lymph nodes. Circulation of lymph. Afferent lymph vessels bring the lymph to the lymph node, where it flows through subscapulous cortical and medullary sinus and finally leaves the gland through efferent lymph vessel. The sinuses are lined with phagocyte macrophages that remove bacteria and other foreign material from lymph. Note well, lymph nodes are the only structures which filter the lymph. Lymph nodes are the only lymphoid organs which have both afferent and efferent lymph vessels. Flow of blood. The blood reaches the lymph node through arteries that enter through hilum. These arteries branch in medulla and for capillary plexus within the cortex. The lymphocytes enter lymph nodes mainly via the arteries. They leave the blood by migration across the wall of postcapillary venules. The arteries enter the lymph nodes through its hilum and gives straight branches because give straight branches because transverse the medulla. In the cortex, arteries from dense arcades of anterior and from arteries. Capillaries are profused around the lymph nodes. Postcapillary high endothelial venule (HEV) are abundant in paracortex and are an important site of blood-borne lymphocytes. Extravasation into lymphoid tissue. The veins leave the lymph node through its hilum. Note well. Most of the lymphocytes enter the lymph node through blood, while only few enter through lymph of afferent lymph vessel. Function of lymph nodes: filter the lymph. For example, when lymph passes through the lymphoid node, foreign particles, injurious substances, including pathogens, are removed by phagocytic activities of macrophages of the lymph nodes. Evoke immunological response. The plasma cells of lymph nodes produce antibodies in response to infection. Produce various types of lymphocytes. The germinal center of lymphatic nodes within the node are site of lymphocyte production. Provide portal of entry for lymphocytes into lymphatic channels. Clinical correlation. Lymphoid nodules. They are circumscribed structures made out of compact lymphoid tissue. Its highly stained central portion is called general center. It is made of lymphoblasts which give rise to lymphocytes. Its darkly stained peripheral portion contains lymphocytes. Germinal centers are absent in embryonic life and in old age. In lymphoid nodules, germinal centers develop only after birth when it is exposed to antigens. The germinal center regresses, which infects subsides. The lymphoid nodules atrophy with increasing age and may be absent in old age. Spread of cancer. The lymph vessels are the most convenient routes of spread of the cancer cells. For example, they are major routes by which carcinoma metastases. When cancer cells enter the lymph vessel, they are trapped in the lymphoid nodes. If cancer cells escape from the lymph nodes, they may pass through lymphoid vessels to the blood and eventually reach to the another part of the body. Therefore, during cancer surgery, malignant cancerous lymph nodes are often removed and their vessels are tied off and cut to prevent the spread of cancer. Lymphadenitis. The acute lymphadenitis, acute infection of lymph nodes, is often caused by microbes transported in it through lymph from the area of infection. The lymph nodes become inflamed and enlarged, and then can be palpated by the clinician. The commonly palpated lymph nodes are cervical, axillary, and inguinal. Figure 11.7 shows the method of palpating cervical, axillary, and epicrolear nodes. Spleen. The spleen is the largest lymphoid organ in the body. It is located deep in the left hypochondrium of abdominal cavity between fundus of stomach and the diaphragm. It is purplish and varies in size in different individuals. Usually it is of the size of a closed fist of the individual structure. It consists of red and white pulp. The spleen thus represents the hemolymph node in the body. The white pulp is the lymphatic tissue sheath that surrounds the central artery. This periarterial lymphatic tissue sheath This periarterial lymphatic tissue sheath possesses nodules with or without centers. These nodules are called splenic nodules and Malpighian corpuscle. The red pulp consists of network of anastomosing spleen cords of Billroth. The spleen cords are made out of lymphocytes, both B and T type, macrophages and plasma cells. The spaces between the cords are occupied by blood sinusoids. The spleen is covered by a connective tissue capsule which sends trabecule within the substance of the organ, where they are repeatedly divided to form the network. The blood-borne antigens are removed. The red pulp consists of spleen cords are made out of lymphocytes, both B and T type, macrophages and plasma cells. The spleen spaces between the cords are occupied by blood sinusoids. The spleen is covered by a connective tissue capsule which sends trabecule within the substance of the organ, where they are repeatedly divided to form the network. The blood-borne antigens are removed in the spleen. These are found along the course of blood vessels in relation to thoracic and abdominal viscera. Their sinuses are filled with blood rather than lymph. The hemal nodes represent an intermediate stage between lymph nodes, and spleen. Functions: filters the blood from antigens and microorganisms, evoke immunological response against the antigens circulating in the blood, produces B and T lymphocytes, removes old and abnormal RBCs, removes bacteria by phagocytosis, stores blood, forms blood cells during fetal life, blood cells during fetal life. Clinical correlation: splenomegaly. The enlargement of splenomegaly is usually secondary to other conditions, i.e., infections, circulatory disorders, blood diseases, malignant neoplasms. Spleen may be infected by blood-borne microbes, for example, malaria, typhoid fever. Circulatory disorder may, like portal obstruction due to cryosis of liver, leads to congestion of blood in spleen. In blood diseases like chronic myeloid leukemia with spleen enlarged to extra workload associated with removing abnormal blood cells. Malignant neuroblast, for example, lymphomas, may cause malignant tumors in spleen. Note well, the most common cause of enlargement of spleen are portal hypertension, malaria, chronic myeloid leukemia, and typhoid fever. Thymus. The thymus is an asymmetrical bilobed organ gland located in the supermediastinum of thoracic cavity behind the manubrium of sternum. Thymus. The thymus is an asymmetrical bilobed organ. The thymus is the central lymphoid organ and essential for development of older lymphoid organs. It is large and well developed in fetus in early childhood. It attains its peak development at puberty, and thereafter it starts innervating, is replaced by fibrofatty tissues. It weighs about 12 to 15 kgs at birth, 30 to 40 at puberty, 10 to 15 gram in at 60 years. Structure: the thymus consists of supporting framework made by epithelial reticular cells and parenchymal cells, for example, lymphocytes and macrophages. Thus, thymus consists the following three main types of cells: epi epitheliocytes, thymatic epithelial cells, lymphocytes, macrophages. Thymus has dual origin. Its epitheliocytes, epithelial reticular cells, arise from endoderm of third phalangeal pouch, whereas its lymphocytes and macrophages arise from mesoderm. Each lobe of thymus is divided into incomplete lobules. Each lobule has a darkly stained cortex at peripheral and a lightly stained medulla in the center. The cortex is densely packed with lymphocytes, thymocytes. The outer part of the cortex contains immature large lymphocytes, lymphoblasts, which divide by mitosis to produce clones of small T lymphocytes, which are pushed into deep part of the cortex. The epitheliocytes help in maturation of T lymphocytes through the hormone thymosin secreted by them. Immunocompetent T cells leave the thymus and through circulation each reach the peripheral lymphoid tissue. The medulla main consists of epitheliocytes and few lymphocytes. The most important feature of medulla is the presence of Hassel's corpuscles. These are made out of concentrically arranged flattened cells, which are the degenerating epitheliocytes. The center of corpuscle contains homogeneous hyaline material produced by degenerating cells of the corpuscle. Note well, the reticulum of all the lymphoid organs is made of reticular cells and reticular fibers except thymus, where the reticulum is formed by epitheliocytes. Functions: the thymus is the site of production of T lymphocytes. It receives immunological incompetent stem cells from bone marrow. In the thymus, these cells divide and mature into T lymphocytes. The specialized group of lymphocytes, thymus dependent cells. These cells leave the thymus via blood of the lymph node, spleen, and other lymphatic tissue. The T lymphocytes are important for both cellular and hormone and humoral immunological response. The thymus secretes a hormone called thymosin, which supports the activity of T lymphocytes through the body. The production of T lymphocyte is most prolific in youth, an essential requi- requisite to the development of protective immune function. For this reason, the thymus weighs about 10 to 15 grams at birth, from 20 to 30 grams at puberty. Therefore, it regresses and is converted into fibrofatty tissue. Clinical correlation: enlarged thymus gland. It is associated with some autoimmune disease, for example, thymotoxosis, Addison's disease, and myasthenia gravis. Autoimmune conditions are those in which the immune system treats normal body cells for secretion as antigens and destroy them. Epithelial-lymphoid system. It consists of mucosa-associated lymphoid tissue. The large amount of encapsulated lymphoid tissue exists in the wall of alimentary, respiratory, and genitourinary tracts. Exists in the wall of alimentary, respiratory, and genitourinary tracts. It is collectively termed as mucosa-associated lymph node (MALT). The mucosa-associated lymphoid tissue is generally subdivided into the following two types: gut-associated lymphoid tissue (GALT), broncho-associated lymphoid tissue. The important collections of aggregations of mucosa-associated lymphoid tissues are as follows: lymphoid pharyngeal tonsil aggregations, pharyngeal tonsil, tubal tonsil, palatine tonsil, lingual tonsil, Peyer's tonsil, abdominal tonsil. Pharyngeal tonsil: it is the aggregation of lymphoid tissue underneath the mucous lining of the roof and the posterior wall of the pharynx. When enlarged due to infection, it termed as adenoid, which obstructs nasal respiration and makes breathing through the mouth obligatory. Tubular tonsil. Tubular tonsil: it is the aggregation of lymphoid tissue around the upper and the posterior margin of the opening of the pharyngotympanic tube in the nasopharynx. Palatine tonsil: it is a large aggregation of lymphoid tissue, one on each side in the lateral wall of the oropharynx in the triangular fossa called tonsil fossa. They are continually infected in children, causing tonsillitis. Lingual tonsil, the dorsal surface of posterior one-third of tongue pharyngeal part, contains numerous lymphoid follicles underneath the mucosa which together form the lingual tonsil. Pierce patch. These are aggregated lymphoid follicles varying from 2 to 10 cm in length underneath the mucous membrane of a small intestine, being largest and most numerous in the ileum and placed lengthwise along the antemesenteric border. The Player's patch are ulcerated in typhoid fever, forming typhoid ulcer, having long axis perpendicular in the long axis of the bowel. Abdominal tonsil. There is a huge amount of lymphoid tissue underneath the mucous membrane of appendix in the form of rounded aggregations of lymphoid follicles which form a ring and together constitute the abdominal tonsil. Reticular endothelial system. The cells of this system are concerned with phagocytosis. The pick up ion gist and store foreign substances. Thus, cells of the system are important for general and local defense mechanism. Different types of cell in reticulo endothelial system are enumerated on table 11.1. 11.1 Different types of cells in reticulo endothelial system and their sites of location. Cells. Macrophages, connective tissue, bone marrow, suprarenal gland. Pericytes, capillaries, macrophages, blood, dust cells, lungs, reticular cells, spleen and lymphoid tissue, Kupffer cells, liver, micro microglia, central nervous system. Lymphoid and immunity. Immunity in the defense mechanism of the body, for example, ability of the body to resist danger from foreign substances such as microorganisms and harmful toxins. Antigens released by them. The defense mechanism of the body releases macrophagocytosis, which is a non-specific engulfing process, and immune response, which is specific reaction to macroorganisms and antigens. The cell types of involved in immune response is lymphocytes. The lymphocytes are smaller than microcytes and have large nuclei. The lymphocytes circulate in blood and are present in large number of lymphatic organ tissue. They develop from pluripotent stem cells in red bone marrow and then travel in blood to lymphoid tissue, whereas in the body where they activated, for example, becoming immunocompetent, which means they are able to respond to antigens, foreign material, for example, bacteria, virus, etc.